MCQs for the internship examination of DVM 2015 class of University of Agriculture, Faisalabad, Punjab, Pakistan. Cell is bounded by a membrane, plasma membrane. Mitochondria is mainly involved in generation of energy. The DNA cycle is mainly present in nucleus. The DNA of cell is mainly present in nucleus. Melanin is cytoplasmic inclusion. In case of mitosis, chromosome number remains constant. In epithelium, junctions between two cells are tight junctions. The spermatozoa moves by flagella. Inside cell, protein synthesis is done by rough endoplasmic reticulum. The non-living component of cell is called inclusion. The mitosis comprises of following number of phases. 4. Animal is a multicellular organism. Glycogen is a major storage form of carbohydrate. The study of cell is called cytology. Fat is stored primarily in adipose cell. The study of development of an organism from zygote to adult is called embryology. Following germ layers take part in the formation of epithelium. All of above: ectoderm, mesoderm and endoderm. Epithelium comprises of single layer, cell layer and more than one cell layer. The epithelium consists of a single layer of cells is called simple. The epithelium having secretory function is called glandular epithelium. The epithelium is called simple epithelium on the basis of number of layers. Techniques that permit direct observation of living cells, including which of the following: phase contrast microscopy and tissue culture. Which of the following is enhanced by chemical fixation enzyme activity? Which of the following techniques is mostly used to locate glycogen in cells? Periodic acid Giff reaction. Frozen sectioning may be required to avoid the removal of which of the following target substances when tissues are prepared for paraffin sectioning? Carbohydrates. Which of the following enzymes is used during DNA cloning procedures to isolate specific gene by cutting DNA at specific nucleotide sequences? DNA polymerase. The agent in which of the following procedures are intended to stabilize tissue structure by coagulating proteins and promote cross-linking? Not known. Which of the following best describes the appearance of a unit membrane during a transmission electron microscope? Trilaminar structure. The synthesis of all proteins appear to be initiated on which of the following cellular components? Free polyribosome. Which of the following pair of functions is most closely associated with Golgi complex? Glycosylation and sulfation of secretory products. Which of the following descriptions best characterize a phagosome? Contains aging organelles. Which of the following is location of Krebs cycle enzyme and mitochondrial DNA? Mitochondrial matrix. Which of the following is the location of electron transport system? Inner mitochondrial membrane. Which of the following is the site of core glycosylation of secretory proteins? Rough endoplasmic reticulum. Which of the following is the site of steroid hormone synthesis? Smooth endoplasmic reticulum. Which of the following is the site of action of tubulin synthesis? Free polyribosomes. Which of the following are important components of exonemes? Microfilaments. Which of the following substances characteristically increases in abundance when increasing age in terminally differentiated cells, such as neurons and muscle lipofuscin? Which of the following are composed primarily of actin or actin-like proteins? Intermediate filaments in rats. Hepatocytes. The crystalline nucleoid dense core of peroxisomes is believed to be composed of which of the following substances? Urate oxidase. Which of the following is the true of the smooth muscles of the iris? Ectodermal origin. Which of the following substances is likely to contain the most Vasorum in its tunica medica, not aorta? Which of the following structures contains the most elastin in its tunica media, medium-sized artery? Which of the following is true of the ventricles are located at the base of the heart? Which of the following is true about capillaries characteristically lack occluding junctions between their lining cells? The sensory nerve fibers of arteries enter through the adventitia. Those that penetrate the farthest into the wall may extend into which of the following layers? Tunica adventitia. How electrical impulses are passed from Purkinje fibers to ventricular cardiac muscle fibers? Cell conduction. Which of the following is the approximate lifespan of an erythrocyte in circulation? 5 weeks. Which of the following is true of the darker staining central region of platelets? Contain marginal bundle of microtubules? Which of the following is the biochemical constituent of the erythrocyte cell surface that is primarily responsible for determining blood type? ABOMN protein. Which of the following is true of null cells are terminally differentiated B lymphocytes? A different cell count of blood smear from a patient with a parasitic infection is likely to reveal an increase in the circulating number of basophils. Which of the following cell type is most likely to be absent in a differentiated cell count of blood smear from normal patient lymphocytes? Which of the following cell type is capable of returning to circulation after leaving the blood to enter the connective tissue? Neutrophils. Which of the following cell type is the most numerous of circulating leukocytes? Monocytes. Which of the following is an agranulocyte that becomes phagocyte after it enters the connective tissue? Eosinophil. It's false. Which of the following cell is an agranulocyte? Basophil, eosinophil, and neutrophils. They are granulocytes. Which of the following cells is a granulocyte that becomes phagocyte after it enters the connective tissue? Monocyte. Which of the following cell types have cytoplasmic granules that contain heparin and histamine? Basophils. Which of the following substance is present in higher concentration in plasma than in serum? Immunoglobulin. Which of the following term refers to the percentage of packed erythrocytes per volume of blood? Hematocrit. Which of the following is the predominant form of hemoglobin present in erythrocytes at birth? Carboxyhemoglobin. Which of the following cell types is more abundant in quantity? Neutrophils. Which of the following epidermal layers contain enucleated squamous keratinocytes and is the most superficial layer? Stratum corneum. Which of the following epithelial layer is most likely to contain both desmosomes and hemidesmosomes? Stratum basale. Keratohyalin granules are particularly abundant and mitotic activity is rare in which of the following epidermal layers? Stratum granulosum. Which of the following epidermal layers is the most superficial layer in which keratinocyte mitosis occurs continuously and in which cells are attached to their neighbors during interface by abundant desmosomes? Stratum spinosum. Which of the following is often absent in thick skin but typically present in thin skin? Erector pili muscles. Which of the following is typical of reticular dermis but not the papillary dermis? Dense irregular connective tissue. Which of the following is characteristic of sweat glands but not of sebaceous glands? Adenomers contain clear cells and dark cells. Albinism can result from an inherited defect in gene encoding which of the following enzymes? Tyrosinase. The border between which of the following is significant site of arteriovenous anastomosis in the skin? papillary dermis of reticular and reticular dermis. Which of the following best describes the composition of renal lobule, medullary ray, and all nephrons that empty into it? Blood in the arcuate arteries subsequently flow into which of the following vascular channels? Interlobular arteries. Collection of cortical tissue between the medullary pyramids are called renal columns of Burton. Which of the following vessels are typically seen at the border between renal cortex and medulla? Arcuate arteries and veins. Which of the following cell types comprises the visceral layer of Bowman's capsule? Podocyte. Which of the following types of epithelium lines the urinary bladder? Transitional epithelium. Which of the following types of epithelium comprises the parietal layer of Bowman's capsule? Simple squamous epithelium. Which of the following type of epithelium lines the thick ascending loop of Henle? The simple cuboidal epithelium. Which of the following types of epithelium lines the prostatic urethra? Transitional. Which of the following epithelium lines the thin lobe of Henle? Simple squamous epithelium. Which of the following epithelium lines the proximal convoluted tubules? Simple cuboidal epithelium. Lingual papillae with gustatory function are fungiform, velate, and foliate. All but one do not contain taste buds. Velate papillae. How many cell types are present in taste buds? None of above. Chemoreceptors of taste buds are present in type 3 cells. Lifespan of sustentacular cells are 10 days. Sustentacular role in taste buds is performed by both A and B, type 1 and type 2 cells. Lysa of tongue in cats is mainly comprised of white adipose tissue. How much minerals are present in teeth? Dentine. 70% minerals are present in teeth. Dentine. All are major salivary glands except that is parotid salivary gland. Striated ducts in sublingual salivary gland are not present in dogs. Stratum granulosum of ruminal mucosal epithelium has a thickness of 1 to 3 cell layers. Zygomatic salivary glands are only present in dog. None but one contain the molar salivary glands. Cat. Esophageal epithelium is non-keratinized stratified epithelium in case of dog. Lamina muscularis is absent in the cranial esophageal part in dog. Gastric glands are of which type? Branched tubular glands. Most numerous cell type in gastric gland is chief cells. Stratum corneum of gastric mucosal epithelium has a thickness of 1 to 20 cells. Shape of cell of squamous spinosum is polyhedral. Plica circularis are the circulatory disposed mucosal folds present in small intestine. Bones are bind together with the help of strong bands called as ligament. Diarthrosis is a highly movable joint. Gomphosis means implantation of teeth. The coronoid process present is termed caudally in ox. The tubercle of ribs is concave in ox. Tuber calcanei is grooved in ox. Fossa ovalis is remnant of foramen ovale. The internal lining of the heart is called endocardium. The largest cranial nerve of the body is trigeminal nerve. Tuber ischiae of os coxi is three-sided in ox. Ischial arch is narrow and deep in ox. Membrane of the surface of bone is called periosteum. The ligament present between two horns of uterus is intercornual ligament. Inguinal canal has the following number of openings: 2. Urethra has both A and B, pelvic part and extra pelvic part. Hormones are the extensions of frontal bone. Horns are the extensions of the frontal bone. Deltoides muscle in the ox has 2 parts. Cytology is the study of cells. Topographic anatomy is the study of relative position of different organs. Leg contains tibia and fibula. Cerebrospinal fluid can be collected from subarachnoid space. Trochlea, a pulley-like structure, is present in femur. Broad ligament in mare has attachment with lumbar region in mare? How many tarsal bones are present in horse? 6. Distal articular surface is oblique in tibia of ox. How many carpal bones are present in horse? 8. How many branches of transverse process are present in 6 cervical vertebrae of horse? 3. The cranial cavity encloses the brain. A well-developed tuber spine is present on scapula of horse. A round spleen is present in the body of chicken. Ulna is reduced bone in horse. Bicipital groove is undivided in ox. How many digits are present in ox? 4. Tubersacral forms a highest point than vertebral spines in ox. Symphysis mandibulae in horse is absent. Which of the following is attached with the mesentery in abdomen? Intestine. How many ligaments are present in stomach of horse? 5. Average length of small intestine is 70 feet. A large round non-articular projection is called tuberosity. A small articular surface is called facet. Collection of cells is called tissue. Collection of pus in tissue is called abscess. Clavicles are well developed in chicken. Thoracic cavity is formed by all of above: sternum, ribs, and thoracic vertebrae. Pneumonia is the inflammation of lungs. Irregular muscular wall of ventricle of heart is called tuberculocorne. Esophagus is more dilatable in ox. Cricoid cartilage of larynx of ox is more compressed. Which of the following is the bone in the ox having two trochlea? Tibial tuberosity. How many ligaments are present in stomach of horse? 5 in number. Calcanean tendon is present in hind limb. Kidneys are bean shaped in both A and B, goat and dog. How many lobes are present in liver of horse? 3. Ulna is reduced in horse. Scapular cartilage is not present in chicken. Greater trochlea is present on femur. Muscle attaches with the bone with the help of both B and C. Aponeurosis and tendon. Diagastricus muscle has two bellies. Popliteus muscle is present in tibia. Longest bone in the body of horse is longissimus dorsi. The chicken belongs to family Phasianidae. The upper jaw of bird is movable due to quadrate bone. The following number of bones from the lower jaw in birds: 5. Fused thoracic vertebrae in birds are called notrium. In birds there are following number of cervical vertebrae: 14. The rib cage in birds is rigid due to tubercle. The sternum of birds is also known as keel. The pectoral girdle is formed by following bones in birds: 3. The robust bone of pectoral girdle in birds is coracoid. The largest wing bone in birds is humerus. The carpometacarpal bone in birds is formed by 3 bones. The largest bone of pelvic limb in birds is tibiotarsus. The os coxae of birds have following number of foramina: 3. There are following number of coelomic cavities in birds: 8. The following structure is present in birds: diaphragm. Lips and teeth are present in birds are replaced by rhamphotheca. The dorsal part of beak in birds is called culmen. On the rostral part of culmen in newly hatched chicken is a small pointed process called egg tooth. In birds, the following structure is absent: soft palate. The mucous membrane of palates bear following epithelium in birds: stratified squamous epithelium. The skeleton of tongue in birds is formed by entoglossal. There are following number of salivary glands in birds: 8. The following part of esophagus is shorter in birds: cervical. The internal lining of esophagus in birds is stratified squamous epithelium. The glandular stomach of birds is called proventriculus. The glandular stomach of birds has a length of 5 cm. The shape of muscular stomach in birds is like biconvex lens. The wall of gizzard is lined by simple columnar epithelium. Jejunum in birds is attached with mesentery. A short blind remnant of yolk sac in birds is called macellus diverticulum. In birds, following number of cica are present. 2. The gallbladder in bird lies in following lobe of liver, right lobe. The endocrine portion of pancreas in birds is beta cells. In birds, the nostrils are bound dorsally by operculum. The voice box of birds is called syrinx. Following number of cartilage are present in birds: 126. The length of lungs in birds is 7 cm. There are following number of ear sacs in birds: 9. The following ear sac is single in bird: clavicular. Birds can fly due to pneumatic bones. Temperature of cow suffering from milk fever is 96 degrees Fahrenheit. The pulse rate in goat is taken from the arteries jugular and maxillary. Foot and mouth in cattle is due to infection of virus. Mark the stress cycle of a healthy cow: 21 days. What is the heat period in buffalo? None of these. Udder section immediately after calving is called udder secretion immediately after calving is called colostrum. Scrotal sac temperature of bull compared to body temperature is less. Dry matter required by a cow of 400 kg body weight should be 10 kg. Pica is caused due to deficiency of phosphorus. Best method of milking is full hand milking. Name the disease where carcass must be pitted with lime. Anthrax. A teaser bull is maintained to detect heat. The total solid percentage of cow milk is approximately 13. Total solid percentage of buffalo milk is approximately 17. Mark the time of insemination of a cow in heat between mid to late heat. Mark the per lactation milk yield of Sahiwal cow: 1800 kg. Gestation period in case of buffaloes is of 307 days. Addition of water in milk will decrease specific gravity. Flushing can increase the lamb crop by 10 to 20%. Small ruminant contribution towards total meat production of the country is 33%. Which one is the fat tail breed of sheep? Salt range. Which one is the kharif fooder? Sorghum. The most killer disease of sheep and goat is enterotoxemia. Vaccination in livestock is mostly done by subcutaneous injection. The total solid percentage of goat colostrum is 20%. Marbling in meat is due to deposition of intramuscular fat. Chivon is the meat of goat. Mohair is the fleece of Angora goat. In cow, if cow gets excited or disturbed at milking time, the hold up milk occurs. It is due to release of adrenaline. A cow can be best judged when she is in full milk production. The udder of good dairy cow should be wide and extend well up behind. Yellow color of cow is due to carotene. Which part of stomach is fully developed in sucking calf? Abomasum. The maximum lactose content is found in the milk of woman. Mastitis in cattle is due to bacteria and virus. A feed high in energy or protein, low in fiber and high digestible is concentrate. The average lactation period in milch goats in Pakistan on average is 120 days. The standard lactation period of milch cattle is 305 days. Name the most common disease transmitted to human through cow's milk. Tuberculosis. Red Sindhi is a milch breed. Mark the age of marking a cow for identification. Mark the age of marking a calf for identification: first day of birth. Mark the total number of all temporary teeth in both jaws of a cow: 20. Mark the optimum age for castration of male calves by bloodless castration method: 4 to 6 months. Castration in female calf is called spaying. Approximate age for sexual maturity of buffalo bull is 22 months. Mark the optimum dry matter percentage in green maize for silage making: 30 to 40%. Mark the pH of good silage: 4.2 to 4.5 mark the maximum moisture in fodder stored as hay, 18%. One livestock unit is equal to body weight of 500 kg. Under hand method of milking, good milker at the stretch can efficiently milk 12 cows, which hormone cause milk ejection oxytocin in a mixed farm. The minimum contribution of total income from animals should be 10%. What is the number of pairs of chromosome in goat? 30. What is the best basis for collection of bull cows for breeding? Dams. Milk yield. Mule is an example of hybridization. Which of the following correctly represents the thumb rule for feeding of buffaloes? 1 kilogram concentrate for each 2.5 liters of milk. Which of the following should not be fed urea? Suckling calves. Name the organ where microbial digestion in non-ruminant animal occurs. Large intestine. Cereal grain byproducts are low in phosphorus, rich in calcium. How much milk should be fed per day to a calf during second week? 1/10 of body weight of the calf. How many crossbred cows can be maintained on green fodder available from 1 hectare of land? 3. Thick yellowish discharge from vagina of cow indicates pyometra. For getting advantage from the male and female genotypes, which practice should be adopted? Embryo transfer. Gestation period of goat is 145 days. Medicines which check the growth of microorganisms but do not kill are antibiotic. The duration of passive acquired immunity is 10 to 20 days. Indicate the period during which the intestinal mucosa of the newborn animal is able to absorb antibody globulin of clostrums up to few hours after birth. The most soluble time of vaccination against HS is just before monsoon. In which disease swelling in the neck throat region is noticed? Hemorrhagic septicemia. Antifoaming agents are used in the treatment of impaction of rumen, which is the casein percentage in milk of Sahiwal cow? 2.55. What is the unit of measuring viscosity of milk? Casein. Casein is the unit for measuring the viscosity of milk. The milk fat percentage is highest in which of the following animals? Buffalo. Which constituent affects the freezing point of milk fat? The total solids content of cow milk is approximately 12.5%. What is the legal standard of solid not fat percentage of buffalo milk? 8.5. At what temperature the Gerber butyrometer should be kept? In hot water bath for determination of milk fat? 65 degrees centigrade. Indicate the nitrogenous substance in milk? Uric acid. In which portion of milk from udder bacteria content is highest? 4. Milk. What is the function of milk veins? To carry blood from udder towards heart. Mark the desirable gain per day of healthy growing calf. 500 gram. Water percentage of cow milk is approximately 50%. Mark the heat period of a healthy goat. 22 hours. Mark the age at first calving of crossbred heifer. 24 to 30 months. Mark the best place of insemination of buffalo in heat. Cervix. Central pair of incisor in cattle start wearing off at 7 to 8 years. Mark the normal pulse rate per minute of a bullock. 60 to 70. Wither is the castrated animal of sheep. Milking of cow yielding 15 kg milk per day should be completed within 7 months. Mark the temperature suitable for normal spermatogenesis in milk. 36.6 degrees centigrade. A vasectomized male is called teaser. Which of the salt in mineral mix of cow prevents goiter? Potassium iodide. Best method of milking of cow is by dry hand. Body temperature of bull as compared to scrotal temperature is more. Best method of recording milk for true picture is to record milk daily. Dry matter per day needed by a buffalo of 500 kg body weight should be 15 kg. For every kilogram of milk produced, the cow needed by the cow is 3 to 5 kilogram of milk. For every kilogram of milk produced, the water needed by the cow is 3 to 3.5. Width of double row system tail to tail barn is 11.5 meter. A double row dairy shed of 24.6 meter into 11.54 meter length cross with can house 40 cows. A constituent found in milk and blood, both is global in parturient paresis, can be prevented by feeding a diet prepartum high in calcium and low in phosphorus. Hemoglobin urea in blood can be treated more efficiently in buffaloes, can be treated more effectively by antifibrinolytic drugs. HS occurs in severe form in cattle and buffalo. In domestic animals, the fertilized egg reaches the uterus 6 to 8 days after fertilization. Infection transmitted to humans through milk is Salmonella. The thermophilic bacteria in raw milk are Bacillus. The protein content of mutton is 18.5%. The fertile life of ovulated bovine eggs is 6 to 12 hours. Most of the glycogen in animal body is present in liver. Oxidative rancidity during frozen storage of meat gradually decreases both A and B odor and flavor. The earliest pregnancy diagnosis test for bovine is progesterone assay. Beta carotene is source of vitamin A, which goat is referred for mohair angora. Calving method. Calving interval is the total sum of service period and gestation days. A common but effective disinfectant for water trough of cattle farm is potassium permanganate. The daily dry matter requirement for cow per 100 kg body weight is 2 to 2.5 kg. Lucerne hay contains 14 to 15% DCP and 15% total digestible nutrients. Most essential vaccination in goats is enterotoxemia. Bone meal is good source of calcium and phosphorus. The most appropriate method of dehorning in calves is caustic potash stick. Mark the minimum milk production of Sahiwal breed in lactation of 300 days as required for registration in Central Herd Book 1900 kg. Mark the age of marking a calf for identification. First day of birth. Mark the total number of all temporary teats in both jaws of cow 20. Mark the optimum age for castration of male calves by a bloodless castration method 4 to 6 months. Castration in female calf is called spaying. Approximate age for sexual maturity of bulls is 22 months. Mark the ovulation time after onset of heat in buffaloes 7 hours. Breeding age of crossbred heifer having attained to 50 kg body weight is 1.5 to 2 years. The control ectoparasites in growing calves. Spraying may be done with BHC solution of 0.5%. At what age of heifers you would suggest vaccination for rinderpest, tuberculosis and foot and mouth disease? 6 months. Mark the optimum calving interval for high level of breeding efficiency in cows 395 days. In general, low percentage of infertility occurs in younger animals but increase in case of older animals, which is approximately 5.6%. Mark the optimum dry matter percentage in green maize for silage making 30 to 40%. Mark the pH of good silage 4.2 to 4.5. Mark the maximum moisture in fodder storage stored as a 18%. One livestock unit is equal to body weight of 500 kg. Mark the age of calf when calf starter can be fed in gruel form 2 weeks. Mark the temperature of electrical dehorner used for disbudding 540 degrees centigrade. Mark the airspace for cow sufficient to provide enough ventilation 22.5 mm3. Mark the age of crossbred heifer when central pair of permanent incisor erupts 1 year 9 months. Mark the minimum score points of dairy cow judged on type and appearance by scorecard method 80 to 70. Mark the length of tail to tail face to face barn including walls for 40 crossbred calves 24.6 meter. Mark the width including of tail to tail barn for keeping 50 crossbred cows 11.54 meter. The best kind of manger is made of cement with corners rounded and is partitioned. Mark the size of stanchion stall per cow 1.2 into 1.5 meter. Underhand method of milking. Good milker at a stretch can efficiently milk 12 cows. If cow gets excited or disturbed at milking time, the hold up of milk occurs due to adrenaline. Mark the most important factor to consider in selection of bull. His dam. The best and only basis of selecting the young untried bull is by pedigree. A cow can be best judged when she is in full milk production. The drug of choice for the treatment of babesiosis in crossbred cattle is imidocarb dipropionate. Which of the following organisms gain access to bovine udder during milking? Staphylococcus aureus. Impetigo is a superficial pustular dermatitis that usually begins on the udder. Signs of equine infectious anemia include intermittent fever and edema of ventral abdomen of legs. Field mastitis test, a screening test to assess the leukocytic count in milk and treatment to remove the organism from the infective udder before signs of mastitis develop, is an example of secondary prevention. Equine glanders is called by Burkholderia milli. Which of the following is most common skin tumor affecting horses? Melanoma. The best site of collecting cerebrospinal fluid in canines is lumbosacral puncture. Congenital pyloric stenosis can be treated by VU pyloroplasty. Pyloroplasty, the term used to describe salivary mucosa located ventral to the tongue, is ranula. The essential phenomena in shock are imbalance between vascular blood and effective volume of blood in circulation. At which type of esophagus choking most commonly occur in cattle? Upper third. The drug of choice in paracetamol toxicity is N-acetylcysteine. Which of the following animal species has the lowest temperature in the morning? Camel. Which of the following is contraindicated while drenching a cow? Holding of tongue. Coprophagia means eating of feces. Bovine ephemeral fever is also known as 3-day sickness. Clinical signs such as vesicles on lips, muzzle, dental pad, tongue, gingiva, interdigital space, and teeth, and reluctant to eat and walk are common in cow buffaloes with FMD. Which of the following organisms gain access to bovine udder during milking? Staphylococcus aureus. Incubation period of cowpox is 3 to 7 days. The most likely diagnosis of paresis immediately following cowing in the Ravi buffalo is milk fever. 7. Serum elevation of following enzyme is good indication for active muscle damage, AST. Which of the following antimicrobial is effective against beta-lactamase producing anaerobic bacteria? Metronidazole. The capacity of an agent to cause disease in susceptible host. Define its pathogenicity. Different diagnoses of anthrax include following except bovine spongiform encephalopathy. Concerning control of anthrax, following measures must be implemented except bathing of healthy animals with mixture of 1% formaldehyde and 3% glutaraldehyde. Which of the following is an infectious agent but not contagious agent? Tetanus. Mange in dogs is caused by demodox. The correct statement about the proper storage of whole blood is that it can be stored at 39.2 Fahrenheit to 50 Fahrenheit, 4 to 10 degrees centigrade for up to 3 weeks. In treating wounds of horses, prophylactic dose of anti-tetanus serum is 1500 to 3000 international unit. BIP is used in the concentration of 1 to 8. A tumor is caused by the discovery that enabled W.C. Röntgen in getting first Nobel Prize in Physics is invention of X-ray machine. The most common cryogenic agent used in veterinary medicine is dry ice. In treating wounds of horses, a prophylactic dose of anti-tetanus serum is 1500 international unit. BIP is used for all of above as fly repellent, antiseptic and desiccant. BIP is used with the concentration of 1 to 8. A scald is an injury caused by both of above hot liquids and steam. Strong electric current passing through animal body may cause both coma and death. Heat stroke is more commonly seen in dogs and horses when intubating an animal. It is essential to remember that the trachea is ventral to the esophagus. Fluid losses through vomiting, diarrhea, etc. are called as sensible losses. Fluid losses through sweating and respiration are termed as insensible losses. Which of the following is not a cause of acquired megaesophagus in dogs? Hirschsprung's disease. Bovine femoral fever is also known as 3-day sickness. Hemorrhagic septicemia in buffaloes is caused by Pasteurella multocida type A. Which of the following is an example of cystodes? Diphylidium canium. Commonly used abbreviation in prescription writing. BID means give twice a day. An enlarged dilated colon is called as megacolon. A complete blood count include white blood cell, hemoglobin, hematocrit, and differential leukocytic count. The color of icteric serum is yellow. Which antibiotic is used is best treatment for canine ehrlichiosis? Doxycycline. Concerning endotoxin, which treatment is least accurate? The polysaccharide is released continuously from gram-negative bacteria. Mannitol is indicated in following conditions except spinal cord injuries. Treatment of choice for transmissible canine venereal tumor is vincristine sulfate. Treatment of choice for transmissible canine venereal tumor is vincristine sulfate. Major cause of hypochromic microcytic anemia is iron and copper deficiency. A month-old Rottweiler pup is presented to you with protracted vomiting, dehydration, bloody diarrhea of day-old standing. Vaccination status of pup was not current. Your most likely diagnosis is canine parvovirus infection. MRI stands for magnetic resonance imaging. CPR stands for cardiopulmonary resuscitation. Hemoglobin, urea occur in all of the following diseases of animals except black water inclusion bodies are found in red blood cells in canine distemper deficiency. Which of the following vitamins most likely would cause the central nervous signs in cats? Thiamine. When respiratory sound can normally be detected without stethoscope. Striders. Canine and feline esophagus is most appropriately treated with cimetidine. Which of the following cells are diagnostic hallmark of immune-mediated hemolytic anemia? Spherocytes. A 7-year-old German Shepherd is presented to you for jaundice and ascites. Laboratory investigations revealed SGPT ELT 792 gram per deciliter. Milligram per deciliter, SAP 1500 milligram per deciliter, total bilirubin 9 milligram per deciliter, albumin 1.6 milligram per deciliter, globulin 4.9 milligram per deciliter. The most likely diagnosis is hepatic cirrhosis. Which of the following vitamin is associated with coagulation of blood? Vitamin K. Brucellosis in cattle is caused primarily by Brucella abortus. Jaundice disease is usually spread among herds by purchase of infected animals. The most commonly type of urinary calculi found in bovine are phosphate. Hookworm infection in cat and dogs is primarily treated with parenteral palmate. Obstructive pulmonary disease is also referred as chronic alveolar emphysema. African horse sickness is of 4 forms. Countries free of rabies maintain this status by quarantine. Clinical signs of tetanus develop by interaction between tetanospasmin and nervous tissue. Major lungworms of horse are dictyocanless. Armfield. The drug of choice in hebronomiasis in horses is B. Ivermectin. Myelin is protein produced by Pseudomonas myelii. Equine distemper is also referred as strangles. Equine herpes virus infection is also termed as equine abortion virus. In horse, tetanus toxin is distributed by 2 routes. Pyogenic dermatitis in horse is caused by Staphylococcus species. Determination of seat and nature of disease is known as diagnosis. Probable outcome of a disease is known as prognosis. The treatment directed towards the cause of disease is known as specific treatment measures to prevent the spread of disease when it likely to develop in animals is Prophylactic treatment horseshoe crab amoebocytes test is known as determination of endotoxin. Horseshoe crab amoebocytes test. X-rays have their greatest harmful effects upon gonadal tissue. The treatment that helps the immune system to combat with disease is known as supportive treatment. In general, superficial bacterial pyoderma in dogs requires systemic antibiotic therapy for minimum of 3 weeks. CMS Section B surgery. Preparing a patient's skin for surgery reduces the bacterial flora to a level that can be controlled by the patient's immune system. Ovariohysterectomy is most commonly preferred in young female dogs. Which of the following does not have to be sterile during surgical procedure to maintain aseptic technique? Mask and ovariohysterectomy may be preferred for all of the following reasons except prevention of prostate cancer. Which of the following statement is true? Female ferrets that are not bred or spayed are like to develop a life-threatening anemia. The client should be instructed to contact the veterinary hospital if any of the following occur with a splint or cast, except the animal is walking on or using the splinted or casted leg. When a dog or cat is spayed, the surgical incision is most commonly made midline caudal to the umbilicus. A chest tube is placed when an animal has pneumothorax. Dystocia is difficult or abnormal, where surgical procedure of the ear include all of the following except enucleation. A decla is also known as onychectomy. Which of the following is not completely removed in an ovariohysterectomy? Broad ligament enucleation may be required to correct proptosis of the eye. Nephrectomy refers to removal of kidney. Which of the following suture material persists in the body for longest period? Proline. Scrotal swelling after orchidectomy is most likely due to a fracture of position. Refers to a placing of the bones back on their normal position. When suture pattern is commonly used to close the skin of cattle following a rheumatomy. Simple interrupted suture pattern is most commonly used to close the skin of cattle following a rheumatomy. Which of the following agents can be used as both an antiseptic as well as disinfectant? Formaldehyde. Which of the following suture material is most appropriate to close the muscle layers of cow following left displacement of abomasum? Third, correct 3 chromic catgut. But is the number of throws required when making a surgical knot through 2? Why is it important to minimize the amount of dead space when suturing to decrease the chance of seroma formation? Which of the following is an absorbable suture material? Polydioxanone. Which factor will not influence how rapidly suture materials are absorbed by the body? Age of patient. Which of the following does not cause increase in respiration rate in anesthetized animal? Increased partial oxygen. Which of the following is not considered of a contaminated surgery? Anal sac removal. Which of the following is not factor influencing the formation of exuberant granulation tissue? Depth of the wound. If a surgical incision is dehiscing, the discharge, if present, is most likely to be a serosanguineous. Which of the following agents has been associated with causing neurological disorders in cat? Hexachlorophene. Which of the following suture material is most likely to cause stitch granulomas if left in too long? Nylon. Which of the following is not included in internal fixation of fractures? Plaster cast application. Regarding laparotomy, midline incision extends from Z5 to pubis on lineal site for epidural anesthesia. In equine is between first and second coccygeal vertebrae. The fracture is called as compound if fractured bone is exposed to external environment. The type of wound healing in which granulation tissue forms filling of the defect is known as second intention. The instrument used to drive pain in medullary cavity is called as hand chuck. The ideal time for elective ovariohysterectomy in female dog is after first heat period. Which of the following drug is used in splenectomy for causing shrinkage of spleen? Adrenaline. The best incision site for removing pups from Uterus during cesarean section is body of uterus. Stay sutures are applied for better handling of an organ to be operated when used as pre-anesthetic. Atropine will inhibit excessive salivary secretion. The soda lime in inhalation anesthesia equipment is used to absorb carbon dioxide. Suture pattern which is suitable for intestinal anastomosis. Gambi suture, which is an absorbable suture material of the following polyglycolic acid. Following are the complication of orchidectomy except orchitis, which nerve is blocked in enucleation. Retrobulbar nerve. The antimicrobial of choice for preoperative use in colostomy is cephalosporin. Which of the following is considered as closed wound contusion? Best stage for amputation of dog tail is less than 3 months. Showing of horse should be done at 3-week interval. Debridement of wound means laying open all the layers of wound, excising of the dead tissue, and through cleaning and dressing of the wound. While administering epidural anesthesia, the anesthesia solution is injected into the extradural space. Cosmetic surgery in veterinary sciences is done for all of the above reasons to improve the appearance of animal, to satisfy the fancy of the owner, to satisfy the sentiments of the owner. Transfixing ligature is preferred in all large blood vessels. Which of the following does not fall in the scope of veterinary radiology? Screening of necrotics. Pentothal sodium is administered in the dog for splenectomy. Pentothal sodium is administered in the dog for splenectomy at the dose rate of 30 to 30 mg body weight. The fracture is called compound if bone is exposed to external environment. Regarding the bone grafting, the bone graft that is taken from animal of same species as that of patient is called as homograft. Dictyofema renale worm infestation is treated surgically by nephrotomy, which surgical procedure is designed to enlarge the vulvar opening. Episiotomy dash complication occurs. Diaphragmatic hernia is a complication that occurs when bones are allowed to heal in non-functional anatomical position. Malunion complication occurs when bones are allowed to heal in non-functional anatomical position. The dog showing abdominal breathing, short gasping breaths, and tucked up abdomen. The most logical thing to suspected would be diaphragmatic hernia. The principle of modern surgery, first laid down by Halsted R8 in number 1 under anesthesia. Dilated pupil indicates adequate plane of anesthesia. Pre-anesthetic agents may decrease the amount of anesthesia needed. Coloplexy is indicated in recurrent prolapse. The most important method of surgical suture is absorbability. Absorbable suture loses the majority of its strength within 60 days. Wound healing may be impaired by all of above, as foreign bodies in the wound, inadequate blood supply and frequent movement, and malignant growth. Tenets of Halsted are all of above, as gentle handling of tissue, aseptic surgery, anatomical dissection, and control of hemorrhage. Institute of Microbiology, Veterinary Epidemiology and Public Health. Venereal transmission of disease in flock occurs through sexual interaction. The hemoglobin is an antigenic determinant present on Newcastle disease virus. In IB virus, infectious bronchitis virus, preferable infects which organ, respiratory and reproductive. Infection disease can be spread from forum to forum through inanimate objects called as fomites. Which of the following disease is transmitted from parrots to human? Psittacosis present of maternal antibodies antagonize the effect of vaccines. Which of the following is viral zoonotic disease of poultry? Bird flu. The occasional occurrence of disease in population is called as sporadic. In cohort epidemiological studies, the word cohort means group. Which of the following is an arthropod? Vector-borne disease of chickens, pyrogetosis. Which of the following is non-immunodiagnostic test? PCR. In case of stable endemic disease, the prevalence equals to I cross D. Which of the following is an example of hydrated cyst zoonosis? Cyclozoonosis. Which of the following are included in intrinsic Determinants of disease. A and C. Sudden outbreak of disease in avian population is called as epornetics. The spread of non-exposed group are compared for the causation of disease, in which studies none of above. For disease forecasting, which of the following system is currently used in epidemiology? GIS, guess, which lack of sensitivity of diagnostic test result in false positive results. The nosocomial infections are acquired from hospital area or based distribution of a disease is referred as spatial distribution. Amount or magnitude of disease in population is called as none of above. Making routine observation on health, productivity and environment is called as monitoring. Transstadial transmission of disease is most commonly observed in protozoan diseases. Mortality of disease can be calculated as number of deaths divided by total population. Dengue fever is an arboviral disease. Prophylactic administration of vitamin K in breastfed babies is an example of specific protection in a bulk of her children. Out of whom 28 are immunized, 8 of them get measles and simultaneously. Subsequently, 14 get measles. Assuming the efficacy of vaccine to be 100%, what is the secondary attack rate? 20%. A village has a total of 100 under 5 children. The coverage with measles vaccine in this age group is 60%. Assuming the efficacy of vaccine to be 100% following the occurrence of a measles case in a child after a visit outside, 26 children develop measles. The secondary attack rate of measles is 66%. In an epidemiological study, the incidence of disease in females is more than that of males, but the prevalence is equal in both. It indicates case fatality is more in female. Which of the following is odds ratio calculated from a given data? Diseased, undiseased, positive 30, 20, negative 20, 30. 2.25. A total of 300 newly diagnosed patients with laryngeal cancer are allocated to treatment with either surgical excision alone or surgical excision plus radiation treatment. Which is the study design? Clinical trial. An analysis of the race of patients who visits an emergency room reveals that 40% are white, 25% are black and 20% are Native American and 15% are Asian. These data would suggest be depicted graphically with a pie chart. A study who conducted in America to find out the proportion of blacks and white Americans in California. This variable chosen is dichotomous. A public health physician wants to study the load of hypertension in Rawalpindi district to establish special screening and treatment services in the mentioned area. Which design is more useful for this cross-sectional? Japan has high rate of stomach carcinoma and low rate of colon carcinoma than the USA. Which study would you suggest to prove to support the environmental effect on the incidence of these cancers? Migrant studies. To give the relevant importance of hypertension control in health services, a researcher wants to study the prevalence of hypertension. He chose a cohort study. The design to assess prevalence is inappropriate. A researcher wants to study natural history of silicosis in a population of industrial workers. Which design is more useful in incidence? If a researcher wants to study precedence relationship between the exposure and effect, which design should he prefer? Cohort. Smokers have risk of lung cancer 4 times more than non-smokers if smoking indicates causal association. This characteristic gives strength of association. The incidence of gonorrhea is continuously increasing in a particular locality. An investigator reveals that more sex workers are living there. This epidemic may be classified as common source continuous exposure. A public health physician wants to study the load of hypertension in Rawalpindi district to establish special screening and treatment services in mentioned area. Which design is more useful in this cross-sectional? In a prospective study of the relationship between oral contraceptive use and subsequent risk of developing heart disease, a cohort of 100 women were followed for 5 years. The results were as follows: present, absent, A 245, B 75, C 750, D 60, 630, A plus C 295, B plus D 705, N is equal to 1000. What is the incidence rate? Absolute risk of endometrial cancer. Among those who did not use oral contraceptives, see 50 plus 50 by 50 plus 50 divided by 50 plus 630. In case of food poisoning, had been reported in hospital. 2 out of these developed mild gastrointestinal symptoms, 4 developed moderate dehydration but recovered, and 2 succumbed to the disease. The characteristic of the organism of food poisoning that produces the severest form of the disease is virulence. The incidence of gonorrhea is continuously increasing in a particular locality. An investigator reveals that in that area most sex workers are living. This epidemic may be classified as common source continuous exposure. In Rawalpindi General Hospital during the month of December, a total of 10 patients were admitted with diagnosis of meningococcal meningitis. The total inpatients in that month were 800. What is the incidence of meningococcal meningitis for month of December? 12.5 divided by 1000. While investigating a patient source epidemic, it was found that 120 students ate 5 different foods: meat, burgers, fried fish, steak, rice, and fruit salad. The relative risk was calculated for all those 5 foods. It was concluded that fish was not responsible for this epidemic. The relative risk of fish is 0.7. Among 10 women with cervical cancer, medical records confirm a past history of herpes simplex type 2 infection in 8. What is the relative risk of developing cervical cancer in women with history of HSV type 2 infection? C. 8 by 2. In an outbreak of cholera in village 2000 population, 20 cases have occurred and 5 died. Case fatality rate is 0.25%. What is the incidence of new cases per 1000 person years in household that had a culture positive cases during the first survey? 10. In a population of 100, measles coverage is 60%. One child get out of station and comes back with measles from home. 20 more children get measles. Secondary attack rate of measles is 5%. Section B for microbiology and immunology. In an antigen, haptens are non-immunogenic. The body that is first formed after infection is immunoglobulin M. Antigens in our body are produced by B lymphocytes. The antibody class type which can cross placenta is immunoglobulin G. Monoclonal antibodies are produced by hybridoma technology. First site of entry of antigen is unbroken skin. The cellular immune response is mediated by B and T cells. The reaction of soluble antigen with antibody is known as precipitation. Interferon is composed of glycoprotein. Active immunity is induced by infection. Immunity is lifelong. Following measles, to prepare vaccine for smallpox, the material used by Edward Jenner is cowpox material. Antibody present in clostrums is IgA. Anthrax vaccine is prepared by attenuated bacilli. Example of cell-mediated immunity are all of these: tuberculin type, contact dermatitis, granulomatous. DPT is used as a vaccine for all of these: diphtheria, pertussis vaccine, tetanus toxoid vaccine. If the microbes used in the vaccine are obtained from patient, they are autogenous vaccine. Following substance may act as antigen. All of these as egg albumin, red blood cell and serum, vegetative protein and snake venom. Which antibody class is majorly involved in mucosal immunity? Immunoglobulin A. The oldest and traditionally used adjuvant in vaccine is alum. Most spoilage bacteria grow at neutral pH. Water activity act as all of above as an intrinsic factor determining the likelihood of microbial proliferation, a processing factor, and an extrinsic factor. The time temperature of combination for HTST: high temperature short time pasteurization of 71 degrees centigrade for 15 seconds is selected on the basis of Coxiella burnetii. Milk fermentation to produce cheese is done initially by inoculating with Streptococcus lactis and Lactobacillus species. Mycobacterium tuberculosis is resistant to heat due to presence of mycolic acid. Water content of milk ranges from 20 to 30%. Bacillus cereus causes sweet curding in the milk by the release of protease in the low temperature long time method of pasteurization. Milk is heated at 60 degrees and 63 degrees centigrade for 20 minutes. Dash are live probiotics are live microbial feed supplements that have beneficial effects on the host by improving its intestinal microbial balance. The first scientist to give the concept of probiotics was Mcq. Green color in milk is caused by Pseudomonas aeruginosa. Red color in milk is caused by both B and C Brevibacterium erythrogenes and Sarcina marcinensis. Yellow color in milk is by Pseudomonas cinzantha. Milk whey comprises of all milk contents except milk fat and casein protein. Nestle yogurt is obtained by monoculture of Lactococcus lactis. Sharp sour flavor in milk is due to environment of Clostridium species in dry milk. Water activity is reduced to 0.2. Oxidation of unsaturated fatty acid imparts tillowy odor. The term back sloping is used widely, particularly in fermented sausage manufacturing. The typical flavor of fishiness is produced by Acromium hydrophylla. Penicillium roqueforti spores are added to the curds just before the final cheese processing. Infection by Coxiella results in disease called Q fever. Rennie, an enzyme from calf stomachs but now produced by genetically engineered microorganisms, can also be used to promote curd formation. Gas production by Propionibacterium contributes to final flavor development and hole or eye formation in the disease. Listeria is found in soft tissues and unpasteurized milk. It can even survive below freezing temperature and can therefore withstand refrigeration. Potato-like flavor in milk is caused by Pseudomonas mucidolens. O157H7 strain of E. coli has been associated with number of foodborne outbreaks and is the cause of bloody diarrhea. pH of milk is 6.8. Camembert cheese is inoculated with spores of Penicillium camemberti. Botulism is an important foodborne intoxication. Section C. Molecular biology. In order to clone eukaryotic DNA into prokaryotic cells, DNA without introns must be added. In the process of cloning eukaryotic DNA into prokaryotic cells, the role of reverse transcriptase is to make double-stranded eukaryotic complement DNA from mature messenger DNA. Complement DNA is eukaryotic DNA with only exons that can be cloned into prokaryotes. The segment of DNA molecule where messenger RNA synthesis begins is called the promoter region. The complementary messenger RNA strand that would be synthesized from the DNA base sequence of CTGAC would be GACUG. The name of the structure that causes the synthesis of RNA to cease is called transcription terminator. Restriction enzymes make staggered cuts at specific sequence in DNA in both donor DNA and plasmid. The complementary messenger RNA strand that would be synthesized from DNA base sequence of CTGAC would be GACUG. Which of the following are limitation of DNA polymerase? None of above. The enzyme helicase unzips and unwinds the DNA molecule. Which of the following statements about DNA replication is true? The leading strand is replicated continuously while the lagging strand is replicated discontinuously. Which of the following events do not occur in phase of mitosis? Chromosomes are replicated. The mitotic spindle fibers attached to chromosome via special structures termed kinetochores. Which of the following statements about microtubules during anaphase is true? Those attached the chromosome shorten, while those that are unattached elongate. Phagocytosis are attached by all of the following except lysosomes. In phagocytosis, the digested contents are eliminated by exocytosis. A lysosome contains lysosome and proteases which digest bacteria. Lysosomes are membrane-bound vesicles that arise from the Golgi apparatus. The lysosome contains hydrolytic enzymes. Which of the following cells will be expected to contain the most active lysosomes? Phagocytosing white blood cells. The number of chromosomes in daughter cells produced by meiosis is half the number of chromosomes in daughter cells produced by mitosis. Which of the following is unique to meiosis crossing over? The purpose of PCR is to make a copy of organism's DNA sequence, so a small number of organisms will become large enough to be identified for DNA amplification to occur. Which of the following are needed? Thermostable DNA polymerase. Tag polymerase starts copying at DNA primers attached to the end of the desired gene. The first step in cloning a gene is isolate the DNA from organism that contains the desired gene. Plasmids are put into bacterial cells by transformation. How many different amino acids are found in natural occurring proteins? 20. Which of the following correctly describes chromatin, the complex DNA and protein from which chromosomes are composed? Which of the following is a common feature of all cells? A lipid cell membrane. Which of the following is a typical feature of virus? Is a genome that may be single or double-stranded DNA or RNA. What is the main function of smooth endoplasmic reticulum? It is the site of destruction of unwanted biological materials. Which of the following is a purine? Adenine. Which of the following replaces thiamine in RNA? Uracil. Which reaction in DNA replication is catalyzed by DNA ligase formation of phosphodiester bond between the 3 OH of one Okazaki fragment and 5-phosphate of the next one on lagging strand? During which phase of cell cycle is DNA replicated? S phase. Which of the following effect on primary structure? The coded pattern. If a single base was deleted from messenger RNA transcript, a complete change in amino acid sequence from the point of deletion. Base substitutions may result in nonsense mutations. Nucleotide contains sugar, a nitrogen containing base and phosphate molecule. Sugar found in RNA is ribose. Sugar found in DNA is deoxyribose. Deoxyribose is pentose. Sugar contain an anticodon transfer RNA. Which of the following is not requirement for protein synthesis? Siliciosome enzyme required for transcription is RNA polymerase. Restriction enzyme capable of making internal cut in DNA is restriction endonuclease. Single-stranded unpaired extension formed by restriction enzyme upon cleavage is called sticky. And all of the following are thermostable polymerase except tag polymerase. The first step in PCR is denaturation. The process of binding primer to denatured DNA strand is called annealing. Section D. General microbiology and bacteriology. Which of the following is a non-pathogen Anabaena species? Prokaryotes are distinguished from eukaryotes by their nucleoid instead of nucleus. Ribosomes are found in the eukaryotic cells. All of above. In mitochondria, free in cytoplasm, on the endoplasmic reticulum. Algae are always photosynthetic. Which of the following does not allow observation of living cells? Fluorescent microscope. Singular small circular DNA is common to chloroplast, prokaryotes, mitochondria. Which of the following components is found in archaeobacterial cell walls? Pseudopeptidoglycan. The arrangement of bacterial cells is a genetically determined trait. The plasma membrane has more function, not including monitoring of the environment. Bacterial treated with lysozyme are protoplast. Which of the following is not found in growth curve? Chemostat. Minimal media must contain a source of trace element. Candle jars are used to culture microaerophile oxygen and reduce atmospheric oxygen. Organisms that thrive in elevated carbon dioxide are called caprophiles. Which of the following drug is used to treat fungal infections? Amphotericin pilifimbria are short, thin appendages extruding from the cytoplasmic membrane of certain bacteria. B and C, attachment and DNA transfer. Which organism is considered an index of fecal pollution of drinking water supply? What organism is considered an index of fecal pollution of drinking water supplies? E. coli. Protective mechanism used by bacteria to survive in host may be capsules. Endotoxins are heat-stable lipopolysaccharides, protein complexes which form the structural components of cell wall of bacteria. Which of the following statement regarding endotoxin is true? True, all have the same effects regardless of bacterial source. Which concentration of ethanol is most effective for this purpose? 70%. Which of the following are reservoirs for human infection? All of above. Food and water, humans and animals. A typical growth curve consists of 4 phases. Which is the correct sequence? Log, exponential, stationary, death. Which of the following are true about viruses? All of above. They are not composed of cells as virions. They cannot metabolize nutrients. They alone cannot reproduce themselves. They contain DNA and RNA. The correct sequence for the viral life cycle is attachment, penetration, biosynthesis, maturation, and release. Compound microscope has none of above. Lyophilizer is used for preserving cultures. Plastic waves are sterilized. Plastic wares are sterilized. None of all. Autoclaving is done at 121 degrees centigrade, 50 lb pressure. The principal dye in gemstain is none of above. Iodine is used in gram staining as mordant. Special staining is used for special structures of bacteria. McConaughey agar is selective medium. Agar in the medium is used to provide none of above. Live bacterial cells can be examined in dark field microscope after gram staining. Gram positive bacteria will be of purple color in simple staining method. Single dye is used after simple staining. Bacterial cells may be of all above: red color, blue color, violet color. Ziehl-Neelsen staining is done for Mycobacterium. Nutrient agar is a basal medium. Anaerobic jar is used for the cultivation of anaerobic bacteria. Smoking is prohibited in microbiology lab due to none of all. Cavity slide is used to study bacterial motility. Oil immersion lens is magnification of 100x. Light source in bright field microscope is none of all. Beakers are sterilized at 171 degrees centigrade. Principal dye in Ziehl-Neelsen staining is none of all. All is true about broth except solidify below 40 degrees centigrade. All is true about agar slant except for anaerobic bacteria. Color of gram-negative bacteria after decolorizer colorless. Which of the following is likely to contain structures composed of an acetyl muramic acid and an acetyl glucosamine? E. coli. Typhoid in human beings is caused by Salmonella species. Quelling reaction is a rapid technique for identification of Streptococcus species. The following are produced by Streptococcus aureus except Tetanospasmin. The following are non-sporing bacteria forming genera except Clostridium. The following species of Brucella cause diseases in goats: Brucella melitensis. The following are acid-fast negative bacteria except Mycobacterium. DPT vaccination is done against Corynebacterium. The following strains of Proteus have cross-reactions antigens with Rickettsia except OX3. Botulism is caused by Clostridium. Following genera are gram-negative except Bacillus. Which of the following is not an indication for performing a urine culture? Glucosuria. Which of the following is not treatment commonly used for protein losing nephropathy such as granulonephritis and amyloidosis? Their sequelae: antibiotics. The which value is not usually increased in canine hyperadrenocorticism, blood urea nitrogen or burn. If you had your choice, which blood type would you avoid administering in a cat for an emergency? Blood transfusion type B, which is not a common clinical sign of hyperadrenocorticism, vomiting, but is the common tumor of the oral cavity in the cat. Squamous cell carcinoma. A 10-year-old mixed breed dog presents for 1 month history, anorexia, lethargy, inappetence. Physical examination reveals pale mucous membrane and mild tachycardia. The CBC shows a MCV of 50 cubic microns, MCH 15, 12 microgram, MCHC 20, hematocrit 22, reticulocytes 40,000 per microliter. What is the most likely diagnosis for the disease? Iron deficiency. Which of these is considered a hepatic leakage enzyme in the dog? Aspartate aminotransferase. Which of the following is complication of long-term sling application on the limb? Contracture of muscles. All of the following are radiographic signs suggestive of megaesophagus except a axial deviation of the main stem bronchi. What is the most common type of lymphoma seen in cats that are positive for feline FELV? Mediastinal. Which of the following anesthetics has the least effect on heart rate? Propofol. Which of the following stone tends to form in alkaline urine? Struvite. Magnesium ammonium phosphate. Struvite. A tibial plateau leveling osteotomy is preferred in dogs to correct for this ruptured cranial cruciate ligament. Lily toxicity results in which of the following cats renal failure? A dog presents to your clinic for acute onset of sneezing after running in the field. You looks into dog's leather passage and remove a grass on. What bacterial infection in this dog predisposed to actinomycosis? Closure of the eyes is mediated by cranial nerve 7 and opening of the eye is mediated by cranial nerve 3. The synthesis of which of the following clotting factor is dependent on vitamin K factor 9? Which of the following is not common sequelae of hypertrophic cardiomyopathy in cats? Right heart failure. A 2-year male Rottweiler presented for intestinal foreign body removal. The dog was taken to surgery for removal of the foreign body. What muscle should the surgeon incorporate into the closure of abdominal incision? Preputialis muscle. Preputialis muscle. A type 2 Salter Harris fracture involves what part of the bone? Epiphysis and physis. Interpret the following results from a 4-year-old female spayed dog. Base deficit anion gap 18, pH 7.30, partial carbon dioxide 29, metabolic acidosis, respiratory alkalosis. The treatment of choice for intact female Doberman with a closed biometry is which of the following? Ovariohysterectomy. Which of the following is most suggestive of pyelonephritis bacteria or white blood cells in urine? Once infected, for what period of time in canine parvovirus usually shed 7 to 10 days. Central venous pressure is a direct measure of blood pressure in the cranial vena cava. Which of these is not an important potential side effect of ketoconazole administration? Decreased glomerular filtration rate. An owner just arrived from a camping trip with his dog. He is worried about his dog, who seems to have undergone a change in behavior after being attacked by a wild animal. Additionally, the owner thinks that the dog's voice has actually changed. What is your top differential rabies? Which of these is major potential adverse side effect of the chemotherapeutic agent? Cyclophosphamide cystitis. Which of the following serovirus now thought to play a role in canine leptospirosis? Ectohemorrhagic canigula and gripotyphosa. Which of the following is not adverse effect of itraconazole administration in dog? Nephrotoxicity. Which of the following is not treatment for supraventricular tachycardia? Lignocaine. Which of the following breed is not predisposed to dilated cardiomyopathy? Border Collie. A 6-year-old domestic short-hair cat has just given birth to 3 kittens However, there are more kittens inside, and 4 hours have passed since the last kitten. What is the best treatment option? Administer oxytocin. What is the most common intranasal tumor in the dog and cat? Adenocarcinoma. Cat has lymphosarcoma. Approximately how long does pregnant last in the dog? Starting from day of ovulation, 63 days. Which of these are you least likely to see in the acute glaucoma in dog? Ophthalmos. Meibomian glands produce which portion of the tear film? Lipid. What is the appropriate treatment for an indolent eye ulcer in dog? Corneal debridement and grid keratectomy. Which of the following breed is predisposed to acanthosis nigricans? Dukshund breed is predisposed to acanthosis nigricans. Which of the following what is the most common cause of exocrine pancreatic insufficiency in the dog? Pancreatic acinar atrophy. What is the causative agent of salmon poisoning disease? Neorickettsia helminthicola. How is BPSc species transmitted? It is vectored by ticks. Which of these compounds is effective at inducing emesis in dog? Apomorphine. When measuring vitamin B12, cyanocobalamin and folate level in dog with respect to small intestinal bacterial overgrowth, which finding is most supportive for this diagnosis? Increased folate, decreased cobalamin. Which of these tumor types is associated with causing G1 ulcers, perioperative hypotension and coagulation abnormalities? Mast cell tumors. Which of the following is not true about doxycycline used in dogs? It can cause cartilage abnormalities in growing puppies. What is the causative agent of Lyme disease? Borrelia burgdorferi. A 13-year-old male castrated domestic long-haired cat presents for polyphagia, weight loss and vomiting. The owner notes that the cat appears redless, more active and more aggressive than before. Which test would diagnose the most likely cause of the sign? Serum T4. You have just diagnosed a biometry in which what is the most common culture culprit? E. coli. What does a PR interval of less than 0.1 seconds on ECG of a cat indicate normal finding? What is the best radiographic view to diagnose or rule out a gastric dilation and volvulus right lateral? Hemoglobin urea is seen in Therio. All are true for protozoa except possesses a rigid cellulose wall. The conversion of sporozoites to cyst form is known as encystation. Trypanosoma brucei is transmitted by glossina. If the flask-shaped ulcers in the mucosa of large intestine in humans are caused by Entamoeba histolytica, Chagas disease in humans is caused by Trypanosoma cruzi. Which of the following protozoa are known as diplomonads? Giardia. All of the following protozoa are food and waterborne except Leishmania. Nagana disease in cattle is caused by Trypanosoma brucei. Trypanosoma cruzi is transmitted by Triatoma. The epimastigote form of Trypanosoma can be found in salivary glands of vector. The inflammation at the site of Trypanosoma brucei is known as canker. The enlarged lymph nodes, especially at posterior cervical region in Trypanosoma brucei infection, is known as Winterbottom's sign. Trypanosoma brucei indicates sleeping sickness in host by the production of tryptophol. The unilateral conjunctivitis, together with edema of upper and lower eyelids and cheek, Trypanosoma cruzi infection is known as Winterbottom's sign. Leishmania multiply within macrophages. Cutaneous leishmaniasis or oriental sore in humans is caused by Leishmania tropica. Visceral leishmaniasis in humans is caused by Leishmania donovani. Tryptomastiosis stage of trypanosoma usually found in vertebrate host. Species of trypanosomes develop in the anterior portion of insect gut are called as salivaria. Species of trypanosomes develop in the posterior portion of insect gut are called as stercoraria. Stercoraria is the species of trypanosomes develop in the posterior portion of the insect gut. How long after conception does Trichomonas fetus cause abortion in cattle? 2 to 3 weeks. Which of the following species is responsible for East Coast fever? Theileria parva. Which of the following species is responsible for Texas cattle fever? Babesia bigemina. Which of the following genera ticks is primarily vector for Theileria parva? Rhipicephalus. Giardia trophozoites contains two nuclei. The unique ultrastructural feature of Giardia is adhesive disc, also called as ventral disc. Balochistan coli contains both macronucleus and micronucleus. The sporulated ovocysts of genus Eimeria contain 4 sporocysts. Each sporocyst of genus Eimeria contains 2 sporozoites. Cecal coccidiosis of chicken is caused by Eimeria tinella. In chickens, intestinal coccidiosis is caused by all of above: Eimeria nicatrix, Eimeria brunetti, Eimeria maxima. Cecal coccidiosis in chicken may be confused with salmonellosis. Toxoplasma gondii, a member of Apicomplexa leishmania, is transmitted by sandfly. Oocyst of genus Isospora contains 2 sporocysts, each having 4 sporozoites within it. The cysts of Sarcocystis are found in striated muscles. The cysts of genus Sarcocystis are known as Meschers tubules. The tracheozoid of Toxoplasma are crescent or banana shaped. Drug of choice against East Coast fever is buparvacone. Anaplasmosis is transmitted mechanically by all of above as horseflies, deerflies, and stablephies. Leukocytogenesis is transmitted by black fly. Histomonas milagridis cause a disease commonly called blackhead. Which of the following species of Plasmodium cause malaria in birds? Plasmodium relectum. Which of the following species of Plasmodium cause malaria in humans? Plasmodium malariae. A mastigote form of leishmania can be found in vertebrate host. Trypanosoma equiperdum cause disease in equines called as dorine. The protozoan parasite Histomonas milagris is transmitted through ingestion of eggs of Heterachus gallinarum. Congenital hydrocephalus is mostly seen in which of the following protozoal infection? Toxoplasma. Which of the following is a rickettsial disease? Anaplasmosis. Helminthology. Benzidimidazoles work against parasites by binding with protein tubulin. Levamisole work against parasites by mimicking acetylcholine. In horse fenbendazole is used to kill helminthisis. Ivermectin acts against parasites by changing the chloride ion channel activity. Anticystodal drugs includes niclosamide. Praziquantel is effective against both A and B as trematodes and cystodes. Humans are accidental hosts of Fisheria hepatica. Which of the following is correct? All are hermaphrodite except Schistosomatidae. Lancet liver fluke is common name of chlonor clonorchisinesis. Clonorchisinesis. Which one is correct way to write the name of organism in binomial nomenclature system? Both A and B as Fisheria hepatica. Fisheria hepatica. Heartworm of dog is name given to Dictyophilaria immitis. Dirophilaria immitis is the heartworm of dog. Fragments of parasites present in feces is Haemonchus contortus. Kidney worm of dog is Diectophyma renale. Helminth parasite found in muscles is Trichinella spiralis. River blindness is also known as onchocerciasis. Chinese or Oriental liver fluke is known as clonorchisinesis. Change of animal species for grazing in particular pasture is known as alternate grazing. Change of pasture for the animal is known as rotational grazing. In Pakistan, the prevalence of gastrointestinal nematodes is high during July to August. Inhibited larval development is known as arrested larval development. Larva 3 may survive in the pasture from autumn until late spring. Insufficient number to initiate infection are called as overwintered larvae. Flotation solutions used for fecal examination are none. Factors affecting fecal egg count are all of above as anthelmintic history and season and type of parasites, species and breed of animal and season. The anthelmintic, also used for ectoparasite, is ivermectin. The parasite of marshy areas is fasciole, a parasite transmitted by hitting poorly cooked beef is Taenia saginata. Hydatidosis is caused by Echinococcus granulosus. Following is the nematode parasite of poultry, Escherichia gallei. The largest tapeworm of poultry is Rayletina. Nematodes mostly feed on all, as host tissue fluids, gut contents, and blood. Mode of reproduction of nematodes is ABC, oviparous parthenogenesis. Direct life cycle is called monogenous. Usually the intermediate host of nematode is arthropod. Larvae following nematodes can penetrate the skin as Ascaris lumbricoids. Maturation of gastrointestinal nematodes mostly occur in feces. Don't know. Largest roundworm of horse is Parascaris equorum. Large roundworm of ruminants is Toxocara vitulorum. Sickleworm is the name of Hetrachis gallinarum. Following is the example of hookworm Ancylostoma canium. Body of following parasite is ribbon-like tapeworm. Clonorchis sinensis is commonly known as both of above as Chinese liver fluke, Oriental liver fluke. Primarily site of infection of adult Fistula hepatica is bile duct. Common name of Prosthogonemus macrorchis is oviduct fluke. Prosthogonemus macrorchis is found in oviduct of FH. Oviduct of fluke is parasite of non-Echinococcus granulosus. Normally contains following number of segments 3 to 5. Beerman apparatus is used for counting the nematode larvae in sample. Knots concentration technique is used to diagnose microfilaria in blood. Final host of Echinococcus granulosus is carnivores. Among all helminthes, only following have segmented body: cystodes. Insecticides generally targets the all of these as central nervous system, growth and development, metabolism, and energy production, and water anion imbalance. Cholinesterase inhibitor plays at synapse in central nervous system. Firing in meat is meant for changing the ecology of synaptic cleft is the firing in meat. Firing is CNS firing is the changing the ecology of synaptic cleft. In nervous tissue, sodium and chloride pumps channel works for conduction of nerve impulses, which border categories used for chlorine channel modulator, both B and C, as ivermectin and fipronil. Anticoagulant insecticide has to mess with vitamin K availability. Organic insecticides includes fipronil. Juvenile hormones is essential for the process of molting. Chitin synthesis inhibitor is lethal for insects. The sign of poisoning with organophosphorus anticholinesterase in insecticides do not include in humans is increased bronchial secretions. The saliva of blood-sucking insects has don't know. Mechanoreceptor responds to touch. The Aedegus is also known as spermatheca. Number of gastric ceca present in digestive system of insects is 5 to 10. Foregut of insects is also known as proctodium. Proctodium. Ovipositor is used for protecting eggs. The dorsal surface of thorax is also known as nota. The acid secreted by ants is formic acid. The value used to control the backflow of digester from ventriculus to crop is stomodeal valve. The legs present on the abdomen of insects are known as prelegs. Phytoptera is a chewing lice. Eggs of Phytoptera are operculated. Minopon galline is shaft louse of birds. Members of Amblycera bite horizontally. Columbi is parasite on both of these as pigeons and doves. Members of Iscon Ischnocera bite vertically. Goniocots galline is known as fluff louse. Bovicola bovis is louse of cattle. Sites of louse infestation are all as skin, hair, and feathers. Life cycle stage of louse are as follows: egg, nymph, adult. Tick belongs to major class Arachnida. Members of order Diplopoda are known as millipedes. Following are the orders of class Insecta except Amphipoda. Following are the orders of class Crustacea except Opilions. Shrimps belong to class Crustacea. Mosquitoes belong to the order of Diptera. Order Acarina contains both as ticks and mice. Lice are categorized in subclass as Exoptrigota. Centipedes are myriapods. Members of order Hemiptera are also known as bugs. Exoskeleton, a segmented body, are jointed and jointed appendages are attributed to phylum Arthropoda. Ladder-like nervous system is characteristic feature of Arthropoda. Following are the subphylum of phylum Arthropoda except Brachiopoda, which class does not belong to phylum Arthropoda. Oligochaeta. Order responsible for the spread of dengue hemorrhagic fever is Diptera. Vector helping the transmission of West Nile virus belongs to subfamily Culicini. Cockroaches belong to the order of Dictyoptera. Order Siphunculo comprises of sucking lice. Mice are classified in order Acri. Following are the members of class Insecta except fish lice. Mouth parts of bugs are adopted for both as piercing and sucking. Hard whitish swelling on bite is present in bug bite. Unhatched bug eggs are opaque and white. Female bug lay 150 to 200 eggs. Adults bugs of family Reduviidae are larger. How many lymph stages are present in bugs? 5. Bug's abdomen is divided into how many segments? 8. How many pair of vestigial wings is present in bugs? 2. Bug's abdomen is covered with bristles. Adult bugs are dorso-ventrally flattened. Ptera means wings. Halters are the balancing organ in order Diptera are formed by hind wings. Members of Nematocerca are called as small-sized flies. Biting midges are the members in Nematoceran family. Psychodida. Psychodida is the biting midges. Members of Psychodidae family in Nematocera are commonly known as biting midges. Arista is present in the antenna of Brachycera. Notify one of the following suborders which is odd with respect to other three Cyclorrhapha. Eyes of black flies can be both A and B, as dioptic and holoptic. Similium may have following larval instars up to 5. Blue tongue is transmitted by culicoids. Scientific name of bedbug is Cimex lectularius. Regarding morphology of bugs, all are true except abdomen with 6 segments. In female bugs, incision on abdomen is called both A and B as mesospermallege and organ of Ribaga. Life cycle of bugs are termed as all of these as hemimetabolous, incomplete metamorphosis, and porometabolism. Condition that caused by bugs in poultry is anemia. Choose the most appropriate statement. Bed bugs are considered as a vector for transmitting of pathogens to humans. Which one is not the morphological part of bug class? Infested premises by bugs can be fumigated by permethrin spray. Appropriate biting time of bugs is known of a curved shape and is present in male bug species is both A and B as Semes lectorarius and Semes hemipterus. Females of mosquitoes lay single egg except that culex. The larvae of mosquitoes are also known as regular, has a well-developed head and a distinct thorax and abdomen. Cyclorrhipa are small to medium-sized flies with short, three-segmented antennae, the last of which often bears a feather-like attachment, the arista. The larval flies have a poorly defined head and mobile and worm-like, often being referred to as maggots. Sissy fly does not lay eggs but produce one larva at a time when it is grown and ready to pupate. Horse flies and deer flies are very striking in their appearance. They are fairly large flies with aggressive biting habits. The housefly is a developmental host of Hebronoma musci, Andrecia megastoma, spiroid nematodes, the cause gastric nematodes, the cause gastric and and cutaneous forms of Hebronomiasis in horse housefly. Upon completing larval development, the larva will back out of the hole and drop to the ground where they will pupate, transform into adult fly. Cattle grub heel fly is both A and B as cattle grub and heel fly. Stable flies can act as mechanical vectors of Trypanosoma evensi. The following disease has been reported to be transmitted by sandflies: Leishmania infectum. Ticks belongs to which major class Arachnida. Members of order Diplopoda are known as millipedes. Following are orders of class Insecta except Amphipoda. Hemiptera, Diptera and Odonta are the orders of class Insecta. Following are the orders of class Crustacea except Opilions. The order of class Crustacea are Mysidacta, Amphipoda and Decapoda. Shrimps belongs to class Crustacea. Mosquitoes belongs to the order Diptera. Order Acrina contains both ticks and mites. Lice are categorized in subclass as Exoptrygota. Centipedes are myriapods. Members of Hemiptera are also called as bugs. Orthoptera is an order of classes within complete metamorphosis. Which of the following insects following includes in Arthropoda? Grasshoppers. Antennae having multiple joints with filiform type are of variable length in Orthoptera. These are two subclasses and 235 subfamilies in this order. Orthoptera. Ortho means straight and ptera means winged. Statement is true. Is true. Orthoptera have mouth parts chewing type. Which of the following is not a head and mouth part of Orthoptera? Salivary duct. In Orthoptera, sensory structure in insect for tasting, smelling and touching are found on palps of both and labium and maxilla. Which of the following not includes in Orthoptera? Bugs. In Orthoptera, upper lip is called labrum. In suborder Brachycera, antennae are shorter than thorax. All are classified in Brachycera except sandfly. Which of the following included in Brachycera? Tabnidi. Abdomen of horsefly have 7 segments. Which of the genus is not included in Tabnidi? Genus Gastrophilus. In horseflies, maxillary pulps are stiffly forward. Larvae of Tabnidae have retractile head and mandible bites vertically. Proboscis are long, soft, hangs down in case of genus Chrysops. Which one of genus has metallic color eyes? None of these. Which one of following genera has some proboscis anatomy? Tabnus and Hemotopoda. Pathology. Animals suffering from anemia have decreased number of red blood cells, pack cell volume, and hemoglobin concentration than healthy animals. High number of basophilic stripling bodies are seen in lead poisoning in animals. Red color urine is observed in both A and B. Morphology of anemia in chronic infections is normocytic normochromic anemia. Protein deficiency leads to hypochromic anemia. Reduced activity of bone marrow leads to decrease in red blood cell total leukocytic count and thrombocytes. Increased bilirubin concentration in blood is seen in hepatocellular damage. Fatty casts are seen in urine of animals suffering from diabetes mellitus. Increased erythrocyte sedimentation rate is indicative of all of above as malignancy, nephritis, and tuberculosis. Mechanisms of neutropenia includes all of above as increased demand or consumption in tissues, decreased marrow production, and increased movement from the circulating neutrophil pole to the marginal neutrophil pole. The precursors of macrophages are monocytes. In case of endotoxic, septic, or anaphylactic shock, retention of neutrophils in normal reservoirs take place usually in capillaries of all above as lungs, spleen, and liver. Screen scrapings are kept potassium hydroxide for digestion of debris. Anisocytosis is variation in size of erythrocytes. Slides stained with immunoperoxidase techniques are visualized in microscope ordinary. Galactose tolerance test is inferior to BSP test in detection of liver damage. Type of anemia in CIN is normocytic normochromic. M by E ratio is increased in infection, leukemia, and hypoplasia of erythroid cells. M to E ratio decrease in hyperplasia of erythroid cells and hyperplasia of myeloid cells. In morphine and chloral hydrate treatment, the urine will be positive for glucose. Hyaline cast will be seen in animals suffering from fever. Waxy casts are yellow or gray in color and highly refractile. Indirect van der Waals test is done to detect unconjugated bilirubin in serum. Fibrinogen is increased in inflammation and chronic nephritis. SGPT is increased only in liver damage. Lactic dehydrogenase is increased in liver, kidney, and heart damage. Which of the following is incorrect? Erythropoietin stimulates red blood cell production. Which of the following can affect neutrophil count in peripheral blood? All, as changes in the rates of marrow production and release, exchange between marginal and circulating neutrophil pool, tissue damage, and corticosteroids. These all can affect the neutrophil count in peripheral blood. Cause of neutrophilia include all of the following except glucocorticoid release. In chronic renal failure, serum creatinine is more than 2 mg%. Acanthosis are erythrocyte with spine-like projections. Lipemic plasma is observed in diabetes mellitus and acute pancreatitis. Decreased leukocyte count is observed in viral and early bacterial infection. Shift to left means increase in immature neutrophils in circulation. Shift to right means increased hypersegmented neutrophils in circulation. Chronic myeloproliferative disorders include which of the following? Primary myelodysplastic syndrome. Number of pus cells increased in urine due to pyelonephritis. Myoglobin in urine is detected in azoturia. Systemic pathology. Polymorphonuclear neutrophils, granulocytes are important cells in bacterial diseases. An old bitch has malignant lymphoma involving lymph nodes in para-aortic region. Bitch is treated with chemotherapeutic agents which results in loss of individual neuroplastic cells through fragmentation of individual cell and cytoplasm. Over several weeks, the size of lymphoma decreases as shown on an abdominal CT scan. By which of the following mechanisms has her neoplasm primarily responded to therapy? Apoptosis. Which of the following would typically result in liquefactive necrosis? Cerebral infarction from middle cerebral artery thrombosis. Frozen section evaluated for a lymph node biopsy from neck of an old dog shows granulomatous inflammation with large areas of necrosis. Which of the following would be the most important to do? Cultures of acid-fast bacilli and fungus. A buffalo with immunodeficiency state presents with weight loss and cough. Chest X-ray shows pulmonary infiltrates. A tuberculin skin test show no reaction. Which of the following interpretation is most correct? She may or may not have tuberculosis. A myeloid consists of extracellular deposits of altered protein in beta platelet sheath pattern. Each of the following may contribute to the formation of edema except increased serum albumin. Unconjugated bilirubin is derived principally from intravascular hemolysis. Markedly decreased concentration responsible for keratitis in hemolytic disease of the newborn is unconjugated bilirubin. The main features of hemoglobin of healing wound is granulation tissue formation in adult pulmonary stenosis and ventricular septal defect. Tetralogy of Fallot includes dextroposition of aorta and right ventricular hypertrophy. Which of the following is most likely to result cyanosis? Left to right cardiac shunt. Clinical manifestations of right heart failure include each of the following except pulmonary edema. Left-sided heart failure is characterized by varices. The edema of nephrotic syndrome is best classified as oncotic. Which of the following is maybe a malignant neoplasm seminoma? Proto-oncogenes are cellular copies of oncogenes that were first found in retroviruses. Which of the following is most useful for staging of tumor? Presence of metastasis. Benign tumors arising from salivary gland epithelium are called adenomas. Which of the following finding is most important for the grading of tumors? Microscopic pleomorphism of nuclei and the number of mitosis. Which of the following activates Hageman factor in blood clotting negatively charged surfaces? Epithelial cells within granulomas are derived from which of the following macrophages? Biologically active metabolites of arachidonic acid include all of the following except complement. Bacterial opsonization is mediated by which of the following antibodies? Predominant cell types in typical chronic inflammatory reactions include all of the following except polymorphonuclear leukocytes. Neutrophilia is most frequently seen in association with which of the following bacterial pneumonia? Chemotactic factors are produced by all of above as lymphocytes, monocytes, and endothelial cells. Which of the following is diagnostic? Pycnosis contains nuclear chromatin. Bats may act as a reservoir for human rabies. Rotavirus infection can cause which clinical entity? Watery non-bloody diarrhea. A granuloma is composed primarily of epithelioid histiocytes and lymphocytes. Severe babesiosis in dogs can result in which of the following all of above as anemia, hypoalbuminemia. Tissue damage in babesiosis occur due to two of the above as anemic hypoxia and overwhelming inflammatory response. Bovine herpes virus 1 cause disease in bovines as infectious bovine rhinotracheitis. In traumatic pericarditis, one of the following type of inflammation occur: fibropurulent. Bilateral corneal opacity is seen in malignant catarrhal fever. Hemorrhagic septicemia in buffalo in Asia is caused by B2 serotype. Nibbling sign of disease in goats is characteristic for disease scrapie. Subcutaneous edema is usually present in the submandibular region and neck, sometimes extending to the brisket in buffaloes at the time of postpartum is hemorrhagic septicemia. Fluid sounds on ausculting of lungs with sweetish fetid breath and reddish on green nasal discharge is characteristic of type of pneumonia, aspiration pneumonia. Predisposing factors for the development of keloid scars include wound infection. The following statements are true for wound infection, all of above, as Staphylococcus aureus is the most common organism to infect surgical wound. MRSA wound infection is usually a result of wound contamination by hospital staff. Aerobic organisms exert their lethal effects by producing endo and exotoxins. Wound healing by severe intention takes place much more slowly than healing by first intention. Clostridium tetani causes gas gangrene. Keloid scars are distinguished from hypertrophic scars by their extent. Following are true about atherosclerosis. Proliferation of smooth muscle cells in intima is typical. The following are true about cerebral infarction. The area of infarct tends to be wedged shape. The following condition can give rise to metastatic calcification, sarcoidosis. In the presence of inflammation, the following are raised, all of above as platelets, ferritin, and ceruloplasmin. One of these do not cause increase in permeability of vascular tissue, adrenaline. The following are true about basal cell carcinoma, palisading of the peripheral cells. One of these is wrong. Gangrene refers to tissue necrosis with or without infection. The following are true with regard to cell growth. Achondroplasia does not affect membranous bone. The following are true about squamous cell carcinoma. Metastasis is usually to the regional lymph nodes. Features of sebaceous cyst include it arises in the dermis. One of the following is true about malignant melanoma. A melanotic type is more aggressive than pygmoid type. After phagocytosis by neutrophils, microorganisms are killed by lysozyme. One of these about anaphylactic is false, occur 24 hours after the initial stimulus. Special strain for amyloid is Congo red. The following is true about chemicals involved in allergic reaction. Prostaglandin 2 vasodilation. One of these is false about granulation tissue, often contains granuloma. Constituents of ampulla may include all of above as air, amniotic fluid, and tumor. The following substances increase in capillary permeability in acute inflammation except angiotensin. Opsonization is mediated by complement components, enhances phagocytosis, and involves mainly the Fc portion of the immunoglobulins. The following promotes wound healing except apocrine cells. The following used in grading tumor except calcification. Tumor necrosis factor alpha is produced by macrophages. The following promotes wound healing are macrophages, myofibroblasts, and platelets. Intracellular messengers include all except GABA. The following are true. The following are true about inositol. Intracellular messengers include all except GABA, gamma aminobutyric acid. The following are true about inositol triphosphate IP3. All of above. It is increased by activation of A1 adenoreceptors. It is produced by the action of phospholipase C, a membrane-bound enzyme. The following statements about tuberculosis are true. Viable bacteria may be found in calcified lesions. Which of the following is least likely to regenerate? Cardiac muscle. The newly formed highly vascularized connective tissue with a component of acute inflammatory exudation is known as purulent exudate. Healing by first intention is characterized by each of the following except abundant granulation tissue. A biopsy is performed on a dog with a mass lesion that proves to be neoplasm. One of the following histopathological findings, the one that has been indicated that neoplasm is malignant, is invasion. Each of the following is an example of apoptosis, stroke caused by thrombosis of middle cerebral artery. Which of the following sequelae of ischemia would be considered an irreversible cellular injury? Rupture of lysosomes. Which virus is involved in the development of feline sarcoids? Papillomavirus. Canine colorectal tumors show dysregulation in which of the following? All of the above, as B catenin, E cadherin, and P53. Thick hyalinized collagen fibers characterize which of the following canine tumors? Keloidal fibroma. The origin of histiocytic sarcomas are mostly likely myeloid dendritic cells. Poultry pathology. Infectious bursal disease caused by the virus of Birnaviridae. Gumboro disease is clinical disease of chicken. Immunosuppression is a characteristic feature of both B and C as chicken infectious anemia and infectious bursal disease. Hydropericardium syndrome in broiler usually occurs at 3rd to 4th week of age. Hydropericardium syndrome in broiler chicken results in swollen liver, with fluid in pericardial sac. Incubation period of infectious bronchitis is less than 24 hours. In young chicks, infectious bronchitis appears as an acute disease. Host for infectious bronchitis virus include chicken. Laryngotracheitis results in intracytoplasmic inclusion bodies in tracheal epithelial cells. Newcastle disease virus infects the birds of all ages. Newcastle disease virus strains employed as live vaccine to protect poultry include mesogenic strains and velogenic strains. Avian influenza virus is a RNA virus having 8 segments. Spiroketosis is caused by Borrelia and Serine. Most common reservoir of avian influenza virus is waterfowl. Mycoplasma gallisepticum infected breeder flocks should not be used for production of chicks. Renal coccidiosis is very common in geese. Mycoplasma synoviae is transmitted by both A and B horizontally and vertically. Roundworms in chicken gut can be successfully removed by administration of levamisole. Copper sulfate toxicity in chicken results in liver damage. Excess dietary calcium level results in urate deposition in kidneys. Characteristic lesion of E. coli infection is pericarditis and perihepatitis. In coccidiosis, hemorrhages occur in intestine. During first week of brooding period of broilers, temperature of brooder should be 90°F. Heat stress can be partially alleviated by administering vitamin C. In ovo vaccination is performed in hatchery at the age of 18 days. Birds suffering from lymphoid leukosis shed virus in their eggs. Among all four aflatoxins B1, B2, G1, G2, the most potent toxin is aflatoxin B1. Thin shell deformed eggs with thin albumin are indicator of infectious bronchitis. Infectious agent known to induce hemorrhagic tracheitis in birds is infectious laryngotracheitis. Layer in birds suffering from fall cholera include facial cyanosis and swelling of wattles. Infectious coryza is a disease of upper respiratory tract. Mycoplasma can be eliminated from the following treatment with none of above. Necrotic enteritis is caused by Clostridium perfringens types A and C. Air sequelitis in young chickens is suggestive of Mycoplasma gallisepticum infection. What are the findings in birds suffering from sulfonamide toxicity? Swollen kidneys. Coccidiosis is a protozoal disease and horizontally transmitted disease. Staphylococcus aureus is responsible for early check mortality. Causative agent of laryngotracheitis is a virus. Laryngotracheitis is a disease of growing and adult chicken. Which of the following diseases spread rapidly in a flock? Infectious bronchitis. In laying hens, infectious bronchitis virus results in thin egg albumin. Breeding hens infected with field infectious bursal disease virus transfers maternal antibodies to their chicks, which may protect them from infectious bursal disease for 2 to 4 weeks. Newcastle disease virus infects the birds of all ages. Velogenic strains of Newcastle disease virus can cause up to 100% mortality in susceptible birds. Nervous signs are a prominent feature of Newcastle disease virus infection caused by velogenic strains. Gross lesions in velogenic Newcastle disease infection in chicken include ulcer in the intestine. Newcastle disease virus strains employed as a live vaccine to protect poultry include mesogenic and velogenic strains. Newcastle disease virus can agglutinate rare rat and sheep red blood cells. Newcastle disease virus spreads by aerosol and contaminated equipment. Following diseases are vertically transmitted to new hatched chickens. None of above. Which of the Eimeria species is poor in cyst production? Eimeria nicatrix. Which of the following tests can distinguish between Newcastle disease virus and avian influenza virus? Heme agglutination inhibition test HAI. What the usual hook of bursa of Fabricius in birds affected with Marek's disease? Atrophied. What is the following salmonella species is? Which of the following salmonella species is host specific? Salmonella gallinarum. What is the appearance of E. coli colonies in McConkie agar pink? What are the which one of the following Eimeria species is the most pathogenic? Eimeria tinella. Route of inoculation of embryonated eggs for Newcastle disease and avian influenza viruses is elentoic cavity. What are the findings in birds suffering from sulfonamide toxicity? Swollen kidneys. Thin shell deformed eggs with thin albumin are indicative of infectious bronchitis. Ear in young chickens is suggestive of Mycoplasma gallisepticum infection. Infectious agent known to induce hemorrhagic tracheitis in birds is infectious laryngotracheae. Causative agent of fowl typhoid is Salmonella gallinarum. Drug of choice for Salmonella is chloramphenicol. Coccidiosis is a disease of broilers and layers. Cecal coccidiosis is caused by Emeria tinella. Coccidiosis is a horizontally transmitted disease. In coccidiosis, hemorrhages occur in intestine. In recovery stages of coccidiosis, birds are most susceptible to clostridial diseases. In chickens, 9 species of Emeria have been described. Aflatoxin is produced by Aspergillus. Which type of bird is more susceptible to aflatoxins? Ducks. The most toxic ochratoxin is ochratoxin A. Non-toxin is produced by Fusarian species. Ochratoxin is a nephrotoxic mycotoxin. In Balkan nephropathies, ochratoxin was involved. Ochratoxin mostly contaminate wheat. Aflatoxin mostly contaminate maize. Microscopic lesions of microtoxicosis in chicken, in liver, biliary hyperplasia. Therapeutic dose of gentamicin in poultry is 5 to 10 mg per kg. After IM injection, gentamicin retained in kidney for 30 days. Vitamin A deficiency in poultry feeds may result in visceral urate deposits. Vitamin D deficiency may result in thin and soft shelled eggs. Heat stress can be partially alleviated by administering vitamin C. Partially cooked muscle is a characteristic feature of heat stress. Dehydration in young chicks is evident by dryness and grooves on the shanks. Concurrent administration of inophore antibiotics and anti-emolin may result in lameness. Vitamin E supplementation of feed and chicks results in improved spermatogenesis. Excess ammonia in poultry house results in respiratory distress. Accumulation of smoke and foul gases in the brooder house may result in respiratory distress and ascites. Which of the Emeria species produce the largest schizones? Emeria nicatrix. Lameness and blindness is observed in flocks suffering from Marek's disease. Birds suffering from lymphadenopathy can be kept for breeding purposes. No. Birds suffering from Marek's disease can be kept for breeding purposes. Yes. Mycoplasma gallisepticum is responsible for respiratory disease. Mycoplasma synoviae is cause of lameness. Chronic respiratory disease is caused by concurrent infection of E. coli and Mycoplasma gallisepticum. Incubation period of CRD chronic respiratory disease is long and protracted. In Mycoplasma gallisepticum infection, prominent lesions are ascolitis and peritonitis. Mycoplasma gallisepticum infect breeder should not be used for production of chicks. Mycoplasma synoviae is transmitted vertically and horizontally. Mycoplasma melagrigidis produced disease in turkeys. Mycoplasma gallisepticum antibodies in the serum are detected by hemogglutination test and serum plate agglutination test HA and SAT. Serum plate agglutination test for Mycoplasma gallisepticum gives false positive results if birds are administered killed vaccines. Infectious coryza is a disease of growing and laying birds. Clinical signs of infectious coryza include swollen and flared sinuses and conjunctivitis. Infectious coryza is transmitted horizontally and reoccurs after treatment. Infectious coryza can be prevented by using killed vaccines, and its incubation period is of short duration, 18 to 36 hours, and it is caused by Pasteurella multocida, and it is a disease of mature and maturing and adult birds in chronic fowl cholera. Characteristics findings are swelling of wattles, purulent pneumonia, and peritonitis. Fowl cholera is spread by carrier birds and mortality rate is above 30%. Necrotic enteritis usually occurs or follows coccidiosis. Causative agent of necrotic enteritis is Clostridium perfringens. and the duration of clinical course is very short, few days of necrotic enteritis. Birds dying of necrotic enteritis are well fed. Ulcerative enteritis is caused by Clostridium colinum. In acute cases of ulcerative enteritis, bird may show no clinical signs. Gangrenous dermatitis is caused by Clostridium species. Clinical signs of Clostridium botulinum infection in chicken are characterized by progressive paralysis. Clostridial organisms produce exotoxins. Staphylococcus aureus is responsible for early chick mortality. In chickens, Staph aureus is mainly responsible for purulent arthritis. Vertically transmitted diseases are Mycoplasma and Salmonella gallinarum. Organism contaminating the eggs in the nest is E. coli. For biosecurity purposes, the distance between two breeding farms should not be less than 1 kilometer. Roundworms in chicken gut can be successfully removed by administration of levamisole. Coccidiosis can be prevented by dietary administration of salinomycin. Egg drop syndrome virus infection results decreased egg production and weak shelled eggs. Egg drop syndrome virus is propagated by dug embryo. In aflatoxicosis, chicken liver shows fatty change. Minimum acceptable level of aflatoxin B1 in poultry feed is 200 parts per billion. Furazolidone toxicosis in chicken is caused by cardiac dilation. Copper sulfate toxicity in chicken results in liver damage. Excess of sodium in poultry feed may result in ascites. Low dietary phosphorus level results in visceral gout. Excess dietary calcium level results in urate deposition in kidneys. Low calcium level in feed results in weak shell of embryos. Colibacillosis is caused by E. coli. Characteristic lesion of E. coli is pericarditis and perihepatitis. In myeloid leukocytes, tumor cells are comprised of polymorph leukocytes. In lymphoid leukocytes, clinical signs continue to appear up to for life. In lymphoid leukocytes, tumor cells give positive reaction for IgM antibodies. In lymphoid leukocytes, tumor do not develop in nerves. Marek's disease virus is present worldwide. Birds are vaccinated for lymphoid leukocytes at 1 week of age. Birds recovered from Marek disease shed virus in their eggs. No. MCQs from physiology. Which subjects deals with the integrated functions of body? Physiology. Which function groups are formed by association of various tissues, organ? What is the thickness of cell membrane? 70 to 100 angstrom. The properties of cells that are equated with those of life includes all growth, reproduction, and metabolism. Failure of tissue or organ to develop is called aplasia. Following process can occur across the cell membrane at the same time, both osmosis and active transport. The process of taking dissolved material into substance of a cell is called absorption. The process by which cell can take in fluid and molecules too large to be carried across the placenta membrane by active transport is called pinocytosis. If useful products are released from the cell, the process is called secretion. Neural excitability is not affected by none of them. Inhibitory transmitters may be both as glycine and GABA. Action potential in nerve fibers differ in both as magnitude and duration. Homeostasis is controlled by regulating the activity of all cardiac muscles, smooth muscle, and gland. Hygrometer is used to measure water content. What percentage of sodium chloride is considered isotonic to mammalian red blood cells? 0.8%. If a bathing fluid has a lower osmotic pressure than the cell, it is called hypotonic. If the bathing fluid has lighter osmotic pressure than the cell, it is called as hypertonic. The property of being able to react to a stimulus is called irritability. Which ion is found in greater concentration inside the cell? K. Rough endoplasmic reticulum is involved in the synthesis of protein. Metabolic water is the water generated in the cell of the body by mitochondria. Largest constituent of protoplasm is protein. Some proteins serve as the structural element in all of them, as hair, wool, and horn. Cell physiology includes application of most of the laws of which subjects chemistry and physics. Which protein represents about 30% of total protein content of animal body? Collagens. Reactive proteins include all of above as enzymes, hormones, and globulins of blood. Lipids include triglyceride, waxes, and prostaglandins. RNA is intimately associated with the synthesis of which constitution of the cell? Proteins. How much percentage of inorganic material is contained in bones? 65%. Which mineral is an essential part of thyroxine iodine? Smooth endoplasmic reticulum is involved in the synthesis of all as glycogen, lipids, and steroids. Oxidase enzymes responsible for producing hydrogen peroxide are present in peroxisomes. Microfilaments may assist all as in the movement of fibroblasts in heart, growth of axons, and contraction of all muscles. Centriole consists of how many paired filaments? 11. Lifespan of red blood cell is of 120 days. Pyrimidine thymine occurs only in DNA. Pyrimidine uracil occur only in RNA. Adenine is always paired with thiamine. Guanine is always paired with cytosine. During starvation of cell, the amount of following may decrease, both RNA and protein. The following are neurotransmitters in the autonomic ganglia: acetylcholine. True statements about the pH of extracellular fluid influences the binding of drugs to plasma proteins. The following occur in the proximal tubules of nephron. All of these, as reabsorption of all glucose, reabsorption of most water, and active reabsorption of sodium. Cytochrome P450 is involved in phase 1 metabolic reactions. Actions of angiotensin 2 includes all of these, as increases the release of aldosterone, reduces renin release from the kidney, and promotes microalbuminuria in normal nephron. All of these. ADH, antidiuretic hormone, increases the permeability of collecting ducts to water. All the filtered glucose is reabsorbed in the proximal tubule. Nearly all the filtered protein is reabsorbed in the proximal convoluted tubules. The release of acetylcholine is blocked by botulinum. Antidiuretic hormone decreases the volume of urine. Insulin secretion is inhibited by atropine. Prolactin secretion is high in female than male, is inhibited by dopamine, is increased in patients taking the phenothiazine. The followings are true about DNA synthesis. It requires DNA polymerase, which with regard to DNA molecules, they can be detected with southern blotting. G proteins are activated by binding of an extracellular ligand to a protein receptor. The following is true about gluconeogenesis, both A and B, as it occurs in liver and it occurs in kidney. With regard to member receptors for hormones, both A and B, as they are often glycoproteins, and with regard to membrane receptor for hormones, they are important for hormones made up of steroid. Following factors tends to increase the rate of glomerular filtration or GFR. All are correct. That are decreased albumin concentration in plasma, vasodilation of afferent glomerular arteriole, and vasoconstriction of efferent postglomerular arteriole. Aldosterone secretion is not controlled by plasma calcitonin concentration. In pregnancy, the lysozyme in the tear film is increased. The intraocular pressure is lower than pre-pregnancy state. Accommodation is decreased. The following may cause an elevated blood urea, renal disease, steroid therapy, and dehydration. The following occur in response to a major surgery: increased potassium loss, increased protein breakdown, and sodium and water retention. Hyperventilation occurs in alkaline urine, fall in plasma bicarbonate concentration, and increased cardiac output. Bradycardia can occur in response to elevated intraocular pressure, ocular massage, and pulling of the extraocular muscle. The prothrombin time assesses the extrinsic pathway of blood coagulation cascade, is prolonged in patients with fat absorption, is increased by warfarin. In human beings, hemorrhages occur by venous constriction, decreased blood flow to the skin, and a fall in cardiac output. A respiratory system exchange gases between the air in lungs and the blood. In lungs, oxygen gas enters the blood and the carbon dioxide exits the blood. Gout is characterized by hyperuricemia, causes scleritis. Patients with gout should avoid eating offal. The following are true about cell-mediated immunity. Cell-mediated immunity can activate the complement system. The following are useful in the diagnosis of HIV: polymerase chain reaction, antibodies by ELISA, P24 protein assay. The following are true about chemicals involved in allergic reactions: prostaglandin 2 vasodilation. In AIDS, the following abnormalities are seen: persistent lymphopenia, decreased interleukin 2 production, impaired delayed cutaneous hypersensitivity reaction. Purines include guanine, are metabolized to uric acid, are mainly synthesized in the liver. Vitamin B12 is essential for metabolism of folic acid in humans, is attached to a glycoprotein in circulation. Its deficiency is characterized by hypersegmentation of neutrophils. Folic acid is water-soluble. Prostaglandins contains 20 carbon atoms, are unsaturated fatty acid contain a cyclopentane ring, are different types of prostaglandins are classified according to the configuration of cyclopentane ring. Pharmacology. Histamine is Pharmacology. Histamine is synthesized from histidine. Prostaglandin is autocoid. Arachidonic acid is precursor of prostaglandins. Aspirin acts as analgesic and antibiotic by inhibiting cyclooxygenase enzyme. Quantal dose response relationship refers to all or none response. Potency of drug means activity of drug per unit mass. Efficacy refers to intrinsic activity of a drug. For computing kinetic parameters, the concentration versus time data is plotted on semi-log graph paper. The discipline of pharmacology dealing with the mode of action is known as pharmacodynamics. Pharmacy deals with preparation of drug. Subscription carries instructions for pharmacist. Sporifics are sleep-indicating drugs are sporifics. Intrathecal administration of drugs means administration into cerebrospinal fluid. In epidural administration, the drug is administered above the durameter. Derivatives of sulfonylamides are called sulfonamide. Metabolite of drug may become poor polar than parent drug. Biotransformation of drug facilitates excretion by converting non-polar drug to polar. Polar substances are excreted easily by kidney. First pass effect decreases the bioavailability of the drugs. Drug administered IV may excrete in feces due to enterohepatic circulation. Biliary excretion of drug refers to excretion in feces. Tick the truth statement. All the antibiotics are antibacterial. All the antibiotics are bacteriostatic and bactericidal. Given drugs given their action due 1 and 2. In anaphylactic shock due to drug, blood pressure drop to critical level. Posology means the study of dosage and dose. Iceberg theory explains the mode of action of volatile general anesthetics. Penicillin gives their bactericidal action due to inhibition of cell wall synthesis. Sulfonamide give their bacteriostatic action due to competing antimetabolites. Tachyplexis or tachyplexis develop within minutes. Tolerance to drug may develop due to increased rate of metabolism of drug. Tachyplexis may develop due to exhaustion of mediators. Acetylene is the chemical mediator at parasympathetic nervous system. Prontosil is reduced to sulfanilamide in the body. Acetate and choline are metabolites of acetylcholine. Chloral hydrate is converted into trichloroethanol by liver, which is an active metabolite. Glucuronide conjugation is missing in cat. Sulfate conjugation is of low level in pig. Sulfonamide are metabolized in body by reaction of acetylation. Drug allergy refers to those situations in which usual response is due to antigen-antibody reaction. Histamine is steroid in following cell in body mast cells and basophils. Idiosyncrasy is attributed to genetic abnormality. Biotransformation facilitates the excretion of drugs by changing them into more ionized and less lipid-soluble. Basic nitrogenous substances available in plants are exploited for their pharmacological actions are called alkaloids. Styptics are used to prevent minor hemorrhages. Oxidative reactions are called non-synthetic reaction. When a drug potentiates or complements the action of other drug phenomenon is called synergism. The substances added to a dose form in addition to active ingredients are called excipient. Hard solid preparation applied to skin under cloth or leather covering known as plasters. Plasters are hard solid preparation applied to skin under a cloth or leather covering. The drug preparation which are used by licking are linctures. Ad libitum means as desired. The mechanism of transport of drug which work like active transport, but the drug does not more against concentration gradient is facilitated diffusion. Hepatic and renal disease increases the half-life. In if the gut motility is increased, then drug absorption is decreased. The rate of drug absorption is greatest in the small intestine. Drug absorption may lead to the tissue perfusion. High vascular organ rapidly acquire a drug. Most drugs and metabolites are excreted by the kidneys. Pharmacodynamics consider the effect of drug in the body and mode of action. A drug allergy occurs when body sees the drug as an antigen and an immune response is established against the drug. The drug reaction receptor interaction is usually reversible. Cholinesterase enzyme is inhibited by organophosphorus pesticide. The osmotic diuretic produces diuresis by increasing osmolarity of tubule urine. Magnesium sulfate acts as purgative because magnesium and sulfate ions are poorly absorbed. MAO inhibitors prevent the metabolism of epinephrine. Acetazolamide produces diuresis by inhibiting carbonic anhydrase. Blood-brain barrier can be crossed by unionized and lipophilic drug. Renal function can be estimated by determining renal clearance of creatinine. Zero-order elimination is dose-dependent. First-order elimination is dose-dependent. Drugs mainly bind to protein in body albumin. H1 receptor of histamines are mainly associated with blood, vascular, and respiratory system. Pharmacognosis deal with properties and identification of drugs. Microsomal enzymes induction leads to shorten the life of drug. Microsomal enzyme inhibitors prolong the half-life of a drug. Renal characteristics of a drug refers the volume of blood cleared of drug per unit time. The volume of blood cleared of drug per unit time. Therio. In general, hormones are classified as proteins, polypeptides, and steroids. Which of the following is a polypeptide? Oxytocin. In the cow, the time of ovulation, oocytes will be at secondary oocyte stage. Which of the following hormones are transported in blood in bound form? All of above, as progesterone, testosterone, and estrogens. Pheromones are hormones-like substances that affect other animals of same species through olfaction. Rectally palpable positive sign of pregnancy in cattle at 45 days of gestation is presence of amniotic vesicles. Functionally, human chorion gonadotropin is predominantly like LH luteinizing hormone is analog of HCG. Ovulation without behavioral stress signs is called silent stress. When a cow not in true heat is bred through artificial insemination, it will result in non-conception. The primary oocytes are differentiated from oogonia. The zygote undergoes cell proliferation to form blastocytic degeneration. The process of maturation is initiated by fetus. The early pregnancy factor has immunosuppressive properties. Presence of progesterone in maternal circulation indicates luteal activity. PFSH stands for porcine follicle stimulating hormone. Circulating concentration of which hormone is lowest at estrus in cow? Progesterone. Which hormone causes the expression of behavioral signs of stress in cow? Estrogen and progesterone. Immunization of cyclic cow against oxytocin will lead to prolongation of the cycle. Ovulation in cattle occurs for 10 to 14 hours after the end of heat. Sperm capacitation in cattle mostly occurs in uterus and fallopian tube. Length of estrus cycle does not change in cattle if embryo dies 10 days after conception. In general, GnRH analogues functionally are more potent than natural gonadotropic releasing hormone. In cattle, oxytocin is synthesized in hypothalamus and corpus luteum, from which duct of embryo the male reproductive system arises. Wolffian duct is the duct from which the male reproductive system is arised. The initiation of puberty in bovine is largely a function of both age and body weight of animals. The first year of puberty animal is often silent because of the lack of progesterone. In bovine, corpus luteum attains maximum size by a ninth to 10th day of cycle. Which of the following animals is an induced ovulator? Camel. What is the time of ovulation in mare? 1 to 2 days before the end of estrus. Which of the following is necessary for ovulation? Pre-ovulatory LH surge. Which of the following inhibits the ovulation? High blood progesterone levels. What is the average duration of estrus period in buffalo? None of above. Placentomes are formed by fusion of maternal caruncles and fetal cotyledons. The first follicle formed in the fetal ovary is called primordial follicle. Which enzyme play a major role in the passage of sperm through zona pellucida during fertilization? Ecrosin. When does zona hatching occurs in the bovine embryo? 9 to 10 days after fertilization. The three germ layers of the embryo develop from embryoblast. What is the type of placenta in cow cotyledonary? In which species 99% pregnancy occurs in the left uterine horn? Camel. The main mechanism involved in the elimination of bacteria from infected postmortem uterus is phagocytosis. Service period is defined as the period from parturition to next conception. Cyclicity in mare is dependent on photoperiod and it starts when daylight to darkness ratio increases. The first stage of parturition is called dilation of cervix. What is the duration of second stage of parturition in the mare? 15 to 30 minutes. In which phase of the estrus cycle uterus is prone to infection? Diestrus. In the cow, during natural mating, the sperm is ejaculated in the vagina. What is the optimal time of insemination in buffalo? 12 to 15 hours after the start of estrus. The second stage of parturition is called expulsion of fetus. The involution of uterus in cattle can be delayed due to both B and C. Joining point of fallopian tube with uterine horn is called uterotubal junction. What is the average length of gestation in buffalo? 310 days. The corpus luteum is a principal source of progesterone. In the mare, foal heat occurs 7 to 13 days after foaling. At puberty, female attains about 60% of its mature body weight. A corpus luteum of pregnancy is also known as corpus luteum vernum. In the pregnancy cow, placentomes can be palpated per rectum as early as 75th day of gestation. Ovarian cells that respond to follicle stimulating hormone are granulosa. What is the chemical nature of GnRH polypeptide? The inhibiting hormone selectively suppresses the secretion of FSH only. Oxytocin is stored in neurohypophysis, which is the main utility hormone in mammals. PGF2 alpha. Which gland secretes melatonin hormone? Pineal gland. From which germ layer of embryo internal reproductive organ develops? Mesoderm. Fructose, a source of energy for spermatozoa, is found primarily in the secretions from seminal vesicles. Average ejaculation volume in normal adult ram is 0.5 to 2 ml. Recommended number of motile spermatozoa per dose of liquid semen is 10 million. The primarily circulating androgen in animal body is testosterone. The sac-like organelle on anterior portion of sperm head is known as acrosome. Absence of sperm in semen is called azoospermia. The descent of testes into scrotum takes place in cattle of 100 to 115 days of gestation. The seminal vesicles are absent in dog and cat. In stallion, the prostate gland is wholly external. Spermatozoa contain lactic dehydrogenase enzymes more than seminal plasma. Important cations of mammalian seminal plasma are sodium and potassium. Sodium and potassium are the important cations for mammal seminal plasma. Spermatogenesis has the following phases: Golgi, cap, acrosomal, and maturation phases. The duration of spermatozoa in rams is 40 to 49 days. The spermatozoa get ability to move in the epididymis. The normal osmotic pressure of seminal plasma is 285 milliosmoles. Leydig cells produce testosterone. The bulk of testes consists of both A and B as seminiferous tubules and interstitial cells. Which function is affected in cryptorchid testis? Sperm production. Which of the following hormone is mainly responsible for libido in the male? Testosterone. In males, LH receptors are found on the interstitial cells of the testes. In male, LH is also known as ICH. Chemically, testosterone is a steroid. Interstitial cell. Which of the following compound is a precursor of steroids? Cholesterol. Clinically, based on the severity, endometritis is classified into 3 degrees. The termination of pregnancy with the expulsion of a fetus of recognizable size before it is viable is called abortion. In cattle, equine chorion gonadotropin is used for multiple follicular growth. Human chorion gonadotropin in veterinary practice is used for treatment of follicular cyst. When a cow has persistent corpus luteum on the ovary, her estrous cycle will be prolonged. The best time of using luteinizing hormone as treatment of follicular cyst is just after artificial insemination. The dose of antimicrobial drug is not fixed entity. The dose may be determined by way of animal. Many drugs are poorly absorbed from a gut, such as cephalosporin, polymyxin, aminoglycosides, and tetracycline. One of the best route is intravenous. The incidence of follicular cyst is associated with high milk production. In cattle, persistent corpus luteum is mostly present pyometra. Prolapse of vagina is differentiated from uterine prolapse by the presence of no cotyledons over everted part. A free Martin heifer is born as co-twin female plus male. Oophorytus is a disease of ovary. Most of commonly used treatment for traction in live calf is Williams long blunt hook. Williams long blunt hook is most commonly used instrument for traction in live cattle. A 4-year-old bitch has been mated with fertile dog, developed enlargement of abdomen looking pregnant. If she does not deliver after full term, what could be the possibility? Pseudopregnancy. Left flank incision is the most common technique and most appropriate for standing animals. The dissection of fetus in the uterus is termed as fetotomy. For pervaginal fetal delivery, the basic obstetrical procedure is repulsion. Repulsion is for pervaginal fetal delivery. In which species uterine torsion is common problem? Bovines. At which stage pregnancy uterus torsion usually occurs? Near parturition. Near parturition pregnancy uterine torsion usually occurs. The most common fetal cause of bovine dystocia is lateral deviation of head. The traction can be safely applied when pelvis is compatible with the fetal size. During handling bovine dystocia for pervaginal fetal delivery, the first step should be rectification of defect. Rectification of defect is the first step that should be during handling bovine dystocia for pervaginal fetal delivery, which is the most commonly injured nerve during fetal traction and bovine dystocia. Obturator nerve. Reneck is most common condition in equine. High incidence of repeat breeding within 25 to 35 days after service in cattle herd is common due to campylobacteriosis. For controlling campylobacteriosis in cattle herd, use only artificial insemination. Occurrence of abortions with retention of fetal membranes quite commonly in a herd is an indication of brucellosis. Breeding bulls get trichomonas infection by serving an infected cow. Inflammation of testes is called orchitis. Salpingitis is the disease of the fallopian tubes. Genital prolapse before parturition is also known as vaginocervical prolapse. A 12-year-old pregnant cow mated with a bull on farm started bloody discharge. During 7th month of pregnancy, what will you expect? A case of brucellosis. A high milk producing cow in her third lactation shows remarkable long stress with copious mucus discharge at an interval of age 16 days, but did not conceive with more than 3 services. What is the most likely diagnosis? Follicular cyst. A steer-like heifer presented with complete anestrus, small valvular lips. On rectal examination, the genital tract was underdeveloped. What is the most common cause based on the history of heifer? Hypoplasia of ovaries. Epidural anesthesia is best performed by injecting the drug between sacrococcygeal space. The chromosome number to an domestic cattle Bos indicus is 60. In artificial insemination in cattle, semen is deposited in body of uterus. The flow cytometric procedure has been developed to separate sperm bearing X and Y chromosome. In bovine embryo transfer, it is transfer from donor to the recipient of fertilized egg. The most important single technique devised for the rapid genetic improvement of animals is artificial insemination. The gametes are haploid cells containing either X or Y chromosome. Synchronization of estrus in a group of cattle can be achieved with prostaglandin F2 alpha if two injections are given 11 days apart. The first birth of a cloned offspring took place in sheep. The current method of embryo transfer in buffalo is transcervical. At 35 days of gestation in cattle, palpation of following will confirm pregnancy. Presence of amniotic vesicle. The chromosome number in sperm of horse is 32. Standard practice to add antibiotics, penicillin and streptomycin in semen extender is at the rate of penicillin 1000 international unit. Add streptomycin 1 mg per ml of extender. Temperature of liquid nitrogen is 196 degrees centigrade. The best temperature of thins of semen is 37 degrees centigrade for 30 seconds. Teasing a bull before mounting results in increased sperm concentration. Best quality of bull semen may be collected by using artificial vagina. Electroejaculation is a method of choice in old or injured breeding bulls, at which development stage the bovine embryos are collected for transfer to recipient morula. Morula is the development stage the bovine embryos are collected for transfer to recipient. What is the most commonly used ultrasound display format in veterinary practice? Brightness mode. In B mode ultrasound, the image of graphene follicle will be black. Ultrasonically, bovine fetal sexing is done at 50 to 60 days of gestation. In male fetus, the genital tubercles are located between hind limbs and umbilicus. In bovines, pregnancy can be detected ultrasonically as early as 12 to 15 days after fertilization. Pregnancy diagnosis through milk or placenta progesterone can be made days after mating. 24 days after mating, pregnancy diagnosis through milk or plasma progesterone can be made. A teaser male is used for estrogen detection. Which of the following is the confirmatory site of heat in cow? Stands to be mounted. Which is the main luteotropic hormone in mammals? Luteinizing hormone. On a B mode ultrasound, image of bone will be bright. Which of the following is applied for recording of movements in female in heat? Pedometer. Temperature of cow suffering from milk fever is 96 degrees Fahrenheit. The pulse rate in goat is taken from jugular and maxillary arteries. Foot and mouth in cattle is due to infection of virus, epthovirus. Average range of bovine stress cycle is 21 days. What is the heat period in buffalo? None of these. Udder secretion immediately after calving is called colostrum. Scrotal temperature of a bull spermatogenesis compared with body temperature is less. Dry matter required by a cow of 400 kg. Body weight should be 10 kg per day. Pica is caused due to deficiency of phosphorus. Best method of milking is full hand milking. Name the disease where carcass must be pitted with lime. Anthrax. A teaser bull is maintained to detect the animal in heat. Total solid percentage of cow is approximately 13. Total solid percentage of buffalo milk is approximately 17. Mark the time of insemination of a cow in heat between mid to late heat. Mark the average lactation yield of Sahiwal cow 1800 kg. Gestation period in case of buffalo is 310 days. Addition of water in milk will decrease specific gravity. Flushing can increase the lamb crop by 10 to 20%. Small ruminant contribution towards total meat production of the country is 33%. Which one is the fat tail breed of sheep? Salt range. Which one is the kharif fodder? Sorghum. The most killer disease of sheep and goat is enterotoxemia. Vaccination in livestock is mostly done by subcutaneous injection. The total solids percentage in goat colostrum is 20%. Marbling in meat is due to deposition of intramuscular fat. Chivon is the meat of goat. Mohair is the fleece of Angora goat. If cow gets excited or disturbed in milking time, the holdup of the milk occurs due to adrenaline. A cow can be judged when she is in full milk production. The udder of good dairy cow should be wide and extend well up behind. Yellow color of milk is due to carotene. Which part of stomach is fully developed in suckling calf? Abomasum. The maximum lactose content is found in the milk of women. Mastitis in cattle is usually due to bacteria and viruses. The a feed high in energy or protein, low in fiber or highly digestible is concentrate. The average lactation period of milch goats in Pakistan on average is 120 days. The standard lactation period of milch cattle is 305 days. Name the most common disease transmitted to human through cow's milk. Tuberculosis. Red Sindhi is a milch breed. Mark the age of marking of calf for identification. First day of birth. Mark the total number of all temporary teeth in both jaws of a cow. 20. Mark the optimum age of castration of male calves by bloodless castration method. 4 to 6 months. Castration of female calves is called spaying. Approximate age of sexual maturity of bull is 22 months. Mark the optimum dry matter percentage in green maize for silage making 30 to 40%. Mark the pH of good silage 4.2 to 4.5. Mark the maximum moisture in fodder stored as hay 18%. One livestock unit is equal to the body weight of 500 kg. Underhand method of milking. Good milker at the stretch can efficiently milk 12 cows. Which hormone causes milk ejection? Oxytocin. In a mixed farm, the minimum contribution to total income from animals should be 10%. 10% is the minimum contribution to total income from animals. What is the total number of pair of chromosomes in goat? 30. What is the best method for selection of bull calves for breeding dams? Milk yield. Mule is an example of hybridization. Which one of the following correctly represents the thumb rule for feeding of buffaloes? 1 kilogram of concentrate for each 2.5 liters of milk. Which one of the following should not feed urea? Suckling calves. Name the organ where microbial digestion in non-ruminant animals occurs. Large intestine. Cereal grains are byproducts are low in phosphorus and rich in calcium. How much milk should be fed per day to a calf during second week? 1 by 10 of body weight. How many crossbred cows can be maintained on a green fodder available from 1 hectare of land? 3. Thick purulent discharge from vagina of cow indicates uterine infections. For getting advantage from the male and female genotypes, which practice should be adopted? Embryo transfer. Gestation period of goat is 145 days. Medicines which check the growth of microorganisms but do not kill are known as antibiotic. The duration of passive acquired immunity is 10 to 20 days. Indicate the period during which the intestinal mucosa of the newborn animal is able to absorb immunoglobulin or of colostrums up to few hours after birth. The most suitable time for vaccination against hemorrhagic septicemia is just before monsoon, in which disease swelling in the neck and throat region is noticed. Hemorrhagic septicemia. Antifoaming agents are used in treatment of infection of rumen. What is the casein percentage of milk of Sahiwal cow? 2.55% is the casein percentage in milk of Sahiwal cow. What is the unit for measuring viscosity of milk? Casein is the unit for measuring the viscosity of milk. The milk percentage is highest in which of the following animals? Buffalo. Which constituent affects the freezing point of milk? Fat. What is the legal standard of SNF percentage? Solid knot percentage of buffalo milk. 8.5 is the legal standard of SNF of buffalo milk. At what temperature? At 65 degrees centigrade. The Gerber butyrosmeter should be kept in hot water bath for determination of milk fat. Indicate the nitrogenous substance in milk. Uric acid. In which for milk portion of the milk from udder bacteria content is highest? In which portion of the milk from udder bacteria content is highest? For milk. What is the function of milk veins? To carry blood from udder towards the heart. Mark the desirable gain per day of healthy growing calf. 500 gram. Water percentage of cow milk is approximately 87%. Mark the heat period of healthy goat. 38 hours is the heat period of goat. Mark the age at first calving of crossbred heifer. 24 to 30 months is the age of first calving of crossbred heifer. Mark the best place of artificial insemination of a buffalo in heat. Cervix is the best place for insemination of buffalo in heat. Central pair of incisors in cattle start wearing off at 7 to 8 years. Mark the normal pulse rate per minute of block. 60 to 70 is the normal pulse rate of bull. Whether is castrated animal of sheep. Milking of cow yielding 50 kg milk per day should be completed within 7 minutes. Mark the temperature suited for normal spermatogenesis in bulls. 36.6 degrees centigrade is the suitable temperature for normal spermatogenesis in bull. A vasectomized male is called teaser. Which of the following is mineral mixture of cow prevents goiter? Potassium iodide. Best method for milking in cow is by dry hand. Best method for recording milk for true picture is to record milk daily. Dry matter per day needed by a buffalo 500 kg body weight should be 15 kg. For every kilogram of milk produced, the water needed by the cow is 3 to 5 kg. For every kilogram milk produced, the water needed by the cow is 3 to 3.5 liter. Width of a double row system tail to tail barn is 11.5 meter. A double row dairy shed of 24.6 into 11.54 length cross with can house 40 cows. A constituent found in milk and blood both is globulin. Globulin is found both in milk and blood. Parturient paresis can be prevented by feeding a diet prepartum high calcium and low phosphorus. Hemoglobinuria in buffalo can be treated more effectively by antifibrinolytic drugs. Hemorrhagic septicemia occurs in severe form in I think cattle and buffalo. In domestic animals, the fertilized egg reaches the uterus immediately. Infection transmitted to humans through milk is both A and B as Salmonella and Listeria. Salmonella and Listeria are the infection transmitted to humans through milk. The thermophilic bacteria in raw milk are Bacillus. The protein content of mutton is 18.5%. The fertile life of ovulated bovine eggs is 6 to 12 hours. Most of the glycogen in animal body is present in liver. Oxidative rancidity during frozen storage of meat gradually decreases in odor and flavor. The earliest pregnancy diagnosis test for bovine is progesterone assay is the earliest pregnancy diagnostic test. Beta carotene is the source of vitamin A. Which goat is reared for mohair angora? Calving interval is the sum of service period and gestation days. A common but effective disinfectant for water trough of cattle farm is potassium permanganate. The daily dry matter requirement for cattle per 100 kg body weight is 2 to 2.5 kg. Lucerne hay contains 14 to 15% DCP and 15% total digestible nutrients. Most essential vaccination in goat is enterotoxemia. Bone meal is good source of calcium and phosphorus. The most appropriate method for dehorning debedding in calf is don't know. Mark the ovulation time after onset of heat in buffaloes. 5 hours is the ovulation time after onset of heat in buffaloes. Breeding age of crossbred heifer having attained to 50 kg body weight is 1.5 to 2 years. The control ectoparasites in growing calves spraying may be done with BHC solution of 0.3%. At what age of heifer you would suggest vaccination of rinderpest, tuberculosis and FMD 6 months? Mark the optimum calving interval for high level of breeding efficiency in cows. 450 days is the optimum calving interval for high level of breeding efficiency in cows. In general, low percentage of infertility occurs in young animals, but increase in case of older cows, which is approximately 5.5 to 6%. Mark the optimum dry matter percentage in green maize for silage making 30 to 40. Mark the age of cow when cow starter can be fed in gruel form 2 weeks. Mark the temperature of electrical dehorner used for disbedding. Mark the temperature for electrical dehorner used for this bedding 540 degrees centigrade. Mark the airspace for cows sufficient to produce enough ventilation 22.5 meters square. Is the airspace for cows sufficient to produce enough ventilation 22.5 meter cube. Mark the age of crossbred heifer when central pair of permanent incisor erupts 1 to 1 year 9 months. Is the age of crossbred heifer when central pair of permanent incisor erupts. Mark the minimum score points of dairy cow judged on type and appearance by scorecard method. 80 to 70 is the minimum score points of dairy cow judged on type and appearance by scorecard method. Mark the length of tail to tail, face to face barn including walls for 40 crossbred cows 24.6 meter. Mark the width including walls of tail to tail barn for keeping 50 crossbred cows 11.54 meter. The best kind of manger is made of cement with corners rounded and is partitioned. Mark the size of tension stall per cow 1.2 into 1.5 meter. Mark the most important factor to consider in selection of bull. His dam production is the most important factor to consider in selection of bull. The best and only basis for selection of young and tried bull is by a pedigree.